Good afternoon, everyone. I really hope that you all are doing great. I am Meg, your host for the day, and I welcome you all at DAMS famous Grey Matter Quiz Season 13. First of all, many congratulations who all made it here. Please, you must applaud for all of you. So this is organized by DAMS, and a name we all are familiar with. DAMS is one of the leading and reputed medical institution in India. We all know, and DAMS is a well-known name in the field of PG medical entrance education. And just few days back only, we have celebrated 25 years of DAMS. So we conduct this quiz every year, and this one is 13th season, and you all are here. Let me introduce you to the quiz masters. We know Dr. Sumer Sethi, everyone. Please put your hands together. Founder of DAMS. And we have Dr. Deepthi Behel, co-founder of DAMS. Please put your hands together for both of them. All right, everyone. So let me introduce to the team. Everyone is sitting here. We have 6 teams, 3 members in each team. So I'm going to introduce very first Team A, East Zone. We have Dr. Shamantika Mandal from Medical College, Kolkata. Please give a big hand. We have Dr. Ankit Das from XIII Medical College, Kolkata. With some energy, everyone. We have Dr. Ahit Agni Mukherjee from XIII Medical College. Now next we have Team B, West Zone. First we have Dr. Jahanvi Dev from BJMC Ahmedabad. Next we have Dr. Shloka Thakkar from BJMC Ahmedabad. And we have Dr. Nishid Thakkar from BJMC Ahmedabad. Now let's come to Team C, Central Zone. We have Dr. Junaid Sheikh from XIII GS Medical College and KEM Hospital, Mumbai. Next we have Dr. Ami Abhijit Ambike from XIII GS Medical College and KEM Hospital, Mumbai. And we have Debayan Banerjee, XIII GS Medical College and KEM Hospital, Mumbai. Alright, now let's come to Team D, North 1 Zone. We have Dr. Abhinav Agrawal from AIIMS, Delhi. Next we have Dr. Vidhi Gupta from Maulana Azad Medical College, Delhi. And we have Dr. Harsh Jain from AIIMS, Delhi. Now let's come to Team E, North 2 Zone. We have Dr. Divyanshu Shukla from GSVM Medical College, Kanpur. Next we have Dr. Shruti Singh from GSVM Medical College, Kanpur. And we have Dr. Ananya Ash, RML, Lucknow. Alright, now coming to Team F, South Zone. We have Dr. Inamuri Sairam from Malla Reddy Institute of Medical Sciences, Hyderabad. Next we have Dr. Bhuvan Rajesh from Ramya Medical College, Bangalore. And we have Dr. Shambhavi Kulkarni from Kempegowda Institute of Medical Sciences, Bangalore. Once again, a very, very warm welcome to each one of you. We are so delighted to see you. So you all are excited or nervous? Excited or nervous? Say? All right, we can read your faces, don't worry. Our quiz masters are here. And the people who are watching us online, let me tell you, please do support your colleagues who all are sitting here. You can leave a comment, you can like the session. We are just about to start this DAMS famous Grey Matter Quiz Season 13. Now, over to Dr. Sumer.
Thank you. So, first of all, I'll tell you our reason for the quizzing. Our reason for this DAMS Grey Matter quiz is, we believe that the quiz comes closest to the competitive exams. Whenever you're playing a quiz, you're always feeling the need to win. And you're always on your toes because you don't know what the other team is going to do. You don't know how they are going to perform. But you have to do your best. You understand? So you cannot hold other team members ki, वो answer बताएं या उनको रोक दें. हम तो अपना best कर सकते हैं. And that is true for any competitive exam. So that is the reason when we started this quiz more than a decade back. And the last 1 decade or so, one thing that we have achieved is every team which wins the DAMS Grey Matter, all the same participants, you will see them winning in their INICET ranks also. You will see them topping the NEET PG exam also. You will see the same faces. And I am sure your faces, the people who are participating today, I want to congratulate you that you have reached to this level after beating all over, you're winning from a preliminary round all over India. So it is, I know you are feeling like an imposter right now कि पता नहीं हमें यहाँ आना भी चाहिए था कि पहुंचना चाहिए था नहीं, लेकिन I am telling you, you truly deserve to be here. And I am telling you, once you win here, you will get the confidence कि मैं आगे भी अच्छा कर सकता हूँ. So that is the idea that we have for this quiz. And every year we have seen this. There is no exception to this rule. People who win DAMS Grey Matter, they top their INICETs, they top their NEET PG. उसी जगह पे आप बैठे हो. मुझे लग रहा है कि we will be meeting you more often. We will be taking your interviews hereafter. मुझे ऐसा strong feeling आ रहा है कि इस quiz के बाद हो सकता है हम आपके इंटरव्यू भी ले रहे हो. मुझे फीलिंग आ रहा है कि उसके बाद हम आपको रिवॉर्ड सेरेमनी में भी बुला रहे हो इसी तरह से. मुझे ऐसा लग रहा है कि इसके बाद आपके पेरेंट्स को भी मिल रहे होंगे हम. सो आई कैन ऑलरेडी फील ऑल दैट. आपको भी वो फीलिंग अभी इमीडिएटली नहीं आ रही बिकॉज आपने अभी देखा नहीं है. मैंने पिछले 25 साल में ये कई बार देखा है. पिछले 25 साल में मैंने कई बार देखा है पीपल हु विन डैम्स ग्रे मैटर, दे विन इन द नीट पीजी, दे विन इन द INICET. With that note, I'll hand over to Deepti to start over with the first round of the quiz. We have prepared a very interesting quiz for you. It is not like a competitive exam. हमने competitive exam वाला theme नहीं रखा है. We have tried to keep it just like how a quiz feels like, so that we can simulate or stimulate different areas of your brain. Are you all set to win? Are you here to win? Yes. And before I start with the quiz, I also want you to know there is a big cash prize to be won by the team, plus free courses to be won, few things to be won. And some of you might be thinking that, sir, after this I will be actually joining my PG, I will be joining my post-graduation, then I will not need a DAMS course. Don't worry, we have even resident courses now on our platform. DAMS courses, they start at first year of MBBS, they go on to your regular courses, they go on to your test and discussion courses. Now we have courses for resident doctors. I'm also proud to tell you today that today we have courses for nurses also on the same platform. Thousands of nurses are preparing for NORCET exam on our app, and thousands of dental doctors are preparing for NEET MDS on your NEETMEDICOz app. So today we are gradually evolving into a healthcare centric coaching platform, and I feel that after your ranks and after your results, you would also be a part of this journey in different manners as well. Over the years, I've seen many of our students, they come back to teach as well. So मुझे लगता है कि जर्नी यहाँ खत्म नहीं होगी. इसके बाद हो सकता है आप क्विज जीतोगे, नीट पीजी के रैंक दिलाओगे, हो सकता है उसके बाद आप इंटरव्यू दोगे, हो सकता है उसके बाद आप पढ़ाने के लिए आओगे. This would lot of things will happen. I can already feel that. I can feel the energy in the house. Let us start with the grand finale, DAMS Grey Matter 2024. Thank you.
So very warm welcome to all of you, and congratulations for reaching this part. And let me tell you that you're already all winners. I think deep down you know that, right? So may the best team win. I'm sure each one of you is here with the spirit of winning it. That's what the competitive spirit is, right? But you already are the best in the league, right? So on that little note, we will start, and we will start with the letting you know what the grand finale is going to be all about. Right, so very, very warm welcome. So now this is the grand finale round for the famous Grey Matter quiz. So we have 6 teams with us. We start from team A in the first round, and in the next round we would go in the reverse order, right? The rounds for the finals are going to go like this. So the first one is going to be a trivia round. The second one is connections. Okay, join the dots and connections. Round 3 is going to be a clinical case round. Round 4 is going to be definitely one of the most interesting ones. It's going to be the buzzer round. Then we have round 5 with recent advances, because we know you are all going to make a big difference as you go forward in your medical journeys. And then we have the ending with the rapid fire round. So those would be the 6 rounds. Yes, grab some water, get your throats cleared, get the energy rolling. Yes. So needless to say, the quiz master's decision would be final, but yes, we are here to be a support system. So all the best, everyone, and as I said, may the best team win. Okay, put out your best foot forward and let's get going. Yes? Okay.
Okay, so in this quiz, there will be total 6 rounds. First round will be trivia, then connections, case rounds, buzzer, rapid advances, rapid fire.
So we would be beginning with the trivia round, right? And in the trivia round, let's get you with the rules of the trivia round. Now, in the first round, we'll have questions related to trivia and medicine. We'll have a total of 12 questions in the round. Each correct response will have a plus 10 marks. Do we want to keep a pass?
There will be a written pass to all the teams. You can have whatever answer you're writing, very quickly we will come to your table and check out the answer. If you've written correct or not, the pass will be given to all the teams so that there is no scope of any luck-based passing. No negative marking, time limit 30 seconds, quiz master decisions are final. Okay, Team A, are you ready? Team A, let me show you the first connect and identify for Team A. Rest of the teams can start writing. We just need to know the connection. Okay.
Team A, are you ready? So here is the first question for Team A. All the best, Team A. Connect and identify. Okay.
So the time is ongoing. By the time Team A, you can answer. So if they are wrong, if you say wrong, then only will pass. Okay. So you have to answer. If you say wrong, then others can start writing.
This indicates polio, and that image shows iron lung in polio.
So he says that it is showing us polio and
what is the second image, did you say?
Iron lung.
Yes.
Okay.
So I think we can give it to them. Full marks, full 10 marks. Well done.
Absolutely, yes.
Well, so the correct answer was the image was showing us the first depiction of funerary stele of Egyptian priest Truma.
Yes. Did you notice he had a shorter leg? Yes, a shorter leg with a stick in his hand, right? So that was one of the first descriptions of polio. And yes, those were the ventilators that we were showing. Great, great job done. So that's a wonderful, wonderful start. Team B, are you ready? All the best. Let's open the house for you. Connect and identify. The time is 30 seconds.
Hello. Rest of the teams, okay, you can come forward also, feel free.
I love the enthusiasm of these kids. They are putting their thinking caps on.
I also want to see what they are seeing.
Okay. Time up. So Team B.
Team B, your final answer.
Team B, are you ready with the answer? Do you want to commit? Sorry? Okay, just a minute.
Hello. So right side it's showing the receptor molecule. We would go with serine kinase receptor. Serine protein kinase receptor.
Which kinase receptor?
Serine receptor. Serine threonine kinase receptor.
Okay. What is the image on the left?
What is the total connection that you want to say? What? And
pretzel or bagel, something.
So how do you connect it to the image B? Because it is connect.
Similar to shape I'm guessing. We're not sure about this, but
So what is the final answer you want to give? Can you give it once and then we decide? What is your answer? What is your connect?
serine threonine kinase receptor. Serine threonine kinase receptor.
Okay. So let us see what the other teams are writing, then we'll see. If any of the other teams, please start writing so that we can see your answer.
Right.
And
Team
we just need the
C.
final connect that you're writing, okay? Anything that you want to write?
Team C, D, E, F, and Team A.
What is the final answer?
Do you want to write your answers?
This one. Okay. And what is your final answer? This one. Okay. And anything you've written? Nothing. Okay. Okay.
Team
And
A?
what is it that you've written? I can't even read it. Okay, I think you're not even sure also. Okay, so I don't think any of the team is having the correct answer. I think somehow the team B was a little close, but we'll give you the correct answer. The correct answer that we have is the first image is showing us the kringle. The
Yes.
second is showing us the Danish pastry, and kringle subunits act as a catalytic switch for plasminogen to plasmin. The answer was tissue plasminogen activator. We were looking for an answer called a streptokinase. That is what we were looking at. You were close, but
Yes.
we were not getting the
You did
exact
say
answer.
receptor, but we didn't have the word kringle or anything related to tissue plasminogen. But well tried, Team B. I think that's a fairly good start. So let's move on to Team C. Team C, are you ready for your question? Okay. So the time will start only when I finish reading the question, okay? Lazare Riviere described in 1646 a patient presenting with palpitations and irregular pulse who died after a relatively short course. At autopsy, round carbuncles were found in the left ventricle, resembling the cluster of hazelnuts and filling up the opening of aorta. Can you tell me what are we talking about?
Ma'am, this was the first description of infective endocarditis.
Absolutely
correct.
Amazing.
Absolutely
to
correct.
the point. Very, very well done.
I think they get the full marks.
Yes,
They get
he was
full
the
marks.
first physician to talk about aortic valve inflammation. Yes, and he also talked about aortic endocarditis. So wonderful, wonderful Team C. Great, great start. So Team D, are you ready, bachas? All the best. And here is going to be your question. An EEG technique by which suspect participation in crime is detected by eliciting electrophysiological impulses. It is a non-invasive scientific technique with degree of sensitivity. Neuropsychological method of interrogation, also referred to as brain fingerprinting.
You need to identify the
the
scientist
scientist.
and his discovery. We need both of them, scientist and the discovery both.
Ma'am, the scientist is Dr. Farewell, and this is P300 murmur technique.
Can you repeat the name of the scientist, bacha?
Dr. Farewell,
Okay, and what was the discovery?
P300 murmur technique, brain mapping.
Okay, so I
So
am.
I think we'll have to pass it to the other
Yes, we'll
teams.
have to pass it to the
So
other
no
teams.
marks for you. Other teams can start writing the answer.
MER technique.
Let's see what the other teams are writing. So let's see. So apart from Team D, can we have the other teams as well to write their answers? And only the written answers would be considered. Dr. Sumer is going to go and check the
Yes.
answers like an invigilator.
Let me see.
Okay.
Okay. Thank you. Okay. Acha, but you have already played it, na? This is what you answered, hai na? No, this is not correct, huh? What is it you answered?
Okay. Team A,
Okay.
Team B, and C. Are you also ready with your written answers?
Anything? No. Okay. So we don't have any correct answer from any of the teams.
Okay. So Team D, unfortunately, the answer is incorrect. Now, he is famous Professor Champadi Raman Mukundan. He was from NIMHANS. He was heading the unit of neuropsychiatry, and the technique that he developed was called as brain electrical oscillation signature profiling
And he is called as the father of neuropsychology in India.
in India. And yes, brain fingerprinting was the other name for the technique. Right, so well tried Team D and better luck next time, but yes, well tried. So Team E, are you ready? Yes, so we are going to have the question for you, which is on your screens. Now, the collection of four, which form the basis of most life, get their name from where they were first discovered or purified from. The first one is the pancreatic gland of oxen. That's where it was discovered or purified from. The second one from the seabird feces. The third one from the cells. The fourth from the thymus. What am I talking about? Can you tell me the collection of these four which form the basis of life? These four things are derived from A. One is derived from the pancreatic gland of oxen. The second derived from seabird. The third, cells. And the fourth, the thymus. What are the four things we are talking about? Yes.
I think the answer is RNA polymerase.
Okay, and anything else you want to add to that? We said it has to be four things, Bachche.
Yeah, we need 4 answers.
This is a collection of 4. The first one derived from pancreatic gland, the second from the seabird feces, the third is derived from the cells, the fourth is derived from the thymus. And we are saying they form the basis of life. Time up. Team E, do you want to commit an answer? Or are you sticking to your answer? Team E, we'll have to commit an answer. Okay. The other teams, apart from Team E,
Okay,
if
so
you
let me
want,
just...
you can commit your answers on a piece of paper and we are going to check that out. What are the 4 things that
You've
this
written?
question
Fine.
is
Okay.
talking about?
Okay. What is it that you've written? Okay. 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 Unfortunately, I don't see any correct answer, but I thought it was straightforward. The key is in 4, beta 4. What are the
is the
4
4
things?
which form the base? So here we are talking about the nucleotide bases.
Adenine, guanine, cytosine, thymine. Thymus was the clue. Thymine,
Thymus.
cell, cytosine,
Cells में क्या रहा है? Cytosine.
feces, guanine. That was the clue.
All right. But was it an interesting question?
Yeah.
Yes.
It was actually doable because these are the four things. That
All right.
was it.
And
Okay.
yes, they're nucleotide bases, so they form the basis of everything, right? But okay, let's move on from this mind-boggling question to the next one. No, but we changed the question.
We changed the question. Previous one was the answer, but I removed it.
So this. Right, so we've changed the question. So team F, are you ready? So identify and what disease do I have? I was the grandson of King George III of England and the first cousin of Queen Victoria. In 1822, at 28 years of age, I developed sudden onset of diminution of vision in both eyes that recovered slowly on its own. In 1827, I again developed vision loss in my left eye, followed by a double vision 3 weeks later that recovered in 1 month. 1 month later of visual recovery, I developed weakness in both legs with loss of sensation in the perineum. The deficit never quite recovered. I subsequently became incontinent for stools. My weakness and balance worsened and I died in 1848.
Okay, so what is your answer?
Sir, multiple sclerosis.
Okay.
Okay,
Can you identify the person also?
Who is the person? Who am I? And what disease I have?
So disease is multiple sclerosis.
Okay.
And King George.
King George is the best answer I have ever heard in my life. So what we'll do is we'll keep you on hold and see what others are saying. You know, let's see what others are saying. Okay. Okay. Okay, what are you saying? Okay, so I think team C and E have a better answer. So we'll, show the answer, then we'll decide. So it is actually the first described case of multiple sclerosis, that is secondary progressive multiple sclerosis, and the person is Augustus D'Este. So I think team C and E had the correct name of the person also. So we'll have to. Huh? They saw this, right? So I think we'll.
Then let's not give the marks to anyone. Anyway,
Okay,
team F couldn't answer, right?
Okay,
so
okay,
they
so,
couldn't
okay,
answer, so we
okay.
will not give the marks to team C and
Okay,
team
okay,
E
okay,
as
okay,
well.
okay, so we'll make this question 0 for everyone.
Yes.
So what we'll do is, I think now to make it more interesting, to avoid any sort of advantage to anyone, for the remaining questions in this round, we can convert it into a buzzer round, if you agree. Because then if someone had seen this slide, maybe it is for everyone. So we'll convert it into a buzzer round, and it will be plus 10, minus 5, or plus 10.
No, just plus 10.
Plus 10, no negative. Then everybody will automatically press the buzzer. Plus
Yes.
10, minus 5.
Do you want to say something, team C? A written pass? Only these two were shown. Okay.
Are you sure?
Yeah.
I am having little doubt on that. Huh?
No, unfortunately.
Okay, so what we
no.
can do is,
Okay.
we can, because they have to see one more question, because then after that we can do
Yes.
it. So,
No, they have already,
So
we've done one round, we'll just go reverse.
okay. They have not gotten the question. I think they gave the disease right. We can give the half marks here, and we go on to they give the disease right. What do you say? Everybody, is that fair that they gave the disease right? Their scientist was not right. We already been shown. So okay, we'll try one more. We'll try one more direct question for team F. Direct question for team F.
Yes, this one was shown.
So we go to the next one.
So we'll go to the next one. So team F, this is going to be a question for you. What is being shown in this historical figure? Identify. You can come closer if you want.
Okay, team F, what do you think? Time is up now. Team F, what do you think is your direct answer?
Team F, do you want to commit an answer? The other teams can write. Yes.
So breastfeeding.
They're saying breastfeeding, which we are not agreed. So what we are going to do is we'll now see what the other teams are writing. Where is your answer? Which one? This one. Okay. Where is the answer? Okay. Drastically they're writing, I think some essay only. Okay. Let me check the other team by them. Okay. 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 Unfortunately, I don't think we can give it to any of them.
So I will.
I'll ask Ruby
Okay,
to
I
explain.
want to know, what did you see in the image? There's a lady.
Some people are
and
saying
there's a baby.
breastfeeding. Some people are saying
But
milestones.
there was no image of breastfeeding. Did you focus on the baby? Okay.
What
What did you focus on? Did you focus on the baby's leg? Come again and focus on the baby's foot. Now
You will like the
begin.
image. It's actually a very beautifully
Yes,
framed
it's
question.
a very beautiful historical representation of one of the very common signs we use. What sign is it? Look at the baby's great toe. Now, no, this is the Babinski's reflex.
Which
Yes.
is normal in a newborn.
Yes,
You can see the Babinski reflex.
this is
This is
actually the first historical representation of Babinski's reflex. So if you look at the great toe, there is an extension and there is spanning out of the other toes. Up to what age is Babinski's normal? up till 2 years of age. Yes, so up to 2 years of age, Babinski's is a normal response, right? So, okay.
Okay, so now what we'll do is for the remaining 4 questions, we will go on to a buzzer kind of a mode so
Yes,
that, you know, nobody is disadvantaged. So first round we have done with the all 6 teams, and now the same round will continue. But because we disqualified 2 questions, so we have only 4 more questions with us, which will go on to buzzer round.
Yeah, I think they can write. Everyone, we'll show the question, everyone writes. Whoever gets the right answer,
okay, that's even
will
more
get
democratic.
the plus marks.
Okay.
Okay? We'll give it as plus 10. Okay, anyone who gets correct answers will get plus 10. So is it clear to all the teams?
No
Sorry?
negative marking.
No negative marking.
Okay.
Yes, the rules are same. No negative marking. Are you ready? So there's no buzzer. Everyone writes their answers. We'll give you 30 seconds. We'll come and check, and then we'll give you plus 10.
I'm
This
already
is
there.
your first question. Identify the German neuropsychiatrist. Very, very commonly used terminology.
Yes.
Identify the German neuropsychiatrist. Try and connect to the trivia. So 30 seconds, do let us know when the time is up.
Anybody who's written, just tell me. Okay. Okay, continue, no problems. Anything? Okay.
Have you all written? The
Anybody?
German neuropsychiatrist. Okay.
Written? Okay. Okay, what is your final answer? Final answer?
So Dr. Sumair, have you checked the answers for
I'm trying
everyone?
my best. Okay. A, B and E have got it correct. A,
All
B
right.
and E
Team
have got
A,
it correct.
what is your answer?
Broadman.
Yes. The scientist is Corbinian Broadman, and the representation of the brain that we showed there were the Broadman areas. Yes? Okay, can anybody tell me what method of staining was used? I mean, no marks for this, just to learn something. So it's called as NISSL, N-I-S-S-L, right? The NISSL staining technique was used, right? Cell staining to see the cytoarchitectural arrangement, right? So what teams? Team A, team B?
E and E. A, B, E.
A, B and E. Well done. You get plus 10. So team A, B and E. Everyone, are you ready for the next question? So again, everyone will write their answers. We will check and plus 10 for if you get it right. Connect and identify the syndrome. Connect and identify the syndrome. Okay? Connect and identify the syndrome. Remember to go back and write your answers. Alright, teams?
Okay, now quickly write your answer, beta. Quickly write your answers. Should I check your answer?
What are these 3 gentlemen doing there? What are these 3 gentlemen? Why are we showing them to you together? These 3 gentlemen.
Okay, anything you've written?
And the syndrome.
Okay, they're still writing. So,
Right.
almost the time is up, time is up. Okay, final answer, F, final answer. Okay, not correct. Okay, no. Not at all. Okay, they're not even writing. Okay, so none of the team gets it
But
right.
when I give you the answer, it's something that we very commonly, I mean, it's not a common disorder, but we all want to learn about it.
I'm sure you have read about this in medicine. It is a
Have you read
very...
about the Brugada syndrome? So what are these 3 gentlemen? So one is Bangut, then Laitai and Pokuri in Japan. Yes? So can you tell me, why do we talk about Bangungut, Sunds and Brugada together? They have a similar presentation. All of these three present with affecting males, typically in their 20 to 40 years of age. They have similar ECG changes. What happens to them at night? Yes, sudden cardiac death. And what is the important thing there? There's no heart problem there, right? Can you tell me what is the reason for sudden death at night? Whether it is Brugada or it is Sunds or it's Bangunguch. Anybody? What happens? Because there is no cardiac problem there. Just to learn a little more.
Okay, so we'll show you the next image. And
Yes, the reason is autonomic imbalance, and which leads to dominant parasympathetic supply, right? Okay, are you ready for the next question? Okay, the next question for you. Identify these Nobel laureates and mention their contribution. Identify the Nobel laureates and mention their contribution.
Name is very difficult.
Yes, we are going to come and going to check. Okay, we'll check for everyone.
Okay, I'm there. Okay, the bells are ringing very fast. Okay,
Yes,
okay,
you all knew this one.
This is the name of the person, do you know? Okay, let's see. Okay, team. Okay, I think we have a very smart bunch of students here.
Absolutely, they are.
Absolutely.
They're all the best.
Okay. I'm sure they anticipated the question only.
Really?
Yeah.
Are they this smart?
All of them have got it right. All
Amazing.
of them. All of
Are
them.
you all
Big hand for all of you. Big
Wow.
hand.
So, please
So every
tell-
one of them has got it
Please
right.
tell me, are you all aspiring to be the Nobel Prize winners? Yes? Or
I
you
think
just
they
go through
anticipated the
them?
latest Nobel Prize as a quiz question. So
Absolutely. So this is amazing. All of you have got the correct answer. So Victor Ambros and Gary Rubkin, Nobel Prize in 2024 for discovery of microRNA. So a big round of applause for all of you. Well done. So plus 10 to all the teams. Good job done, people. Are you ready for the next one?
in the next one, you have to identify
Okay,
a Scottish
I am
pathologist.
a Scottish pathologist.
Scottish pathologist who studied brain samples
Oh.
using microscopes and described the role of inflammation and damage to myelin. Landmark paper in 1916 for histology of disseminated sclerosis. Who am I?
And now I
You
know
know
why
this,
Dr.
you
Sumer
know
wanted
this.
to read it out. Who am
Scottish pathologist. Pathologist is the key. And the
I?
time
Inflammation
is...
and damage to myelin. Landmark paper on the histology
Okay,
of disseminated sclerosis.
Okay, let's see the answers now.
Come on, teams. It is yet another opportunity to get plus 10.
Okay, very good, very good. Okay, very
Alright.
good. I'm just
Team
pretending to
D
write.
seems to be, E seems to be
Okay.
impressing Dr. Sumer quite a lot with your answers. Good job, good job. Keep it up.
I think only the team C got it right.
Only
This
team
is
C got it
the
right.
guy that we talk about in all our classes. He's the guy behind the Dawson's fingers.
Yes,
James Walker Dawson, who described the perivenular demyelination seen as finger-like areas of demyelination in multiple sclerosis.
Well
He's
done,
the pathologist
Team
who
C.
described the Dawson's fingers.
Well
Okay,
done,
well done, well
So
done.
plus 10.
So at the end of this round, do we have the scores?
Let's look at the scores
Do you have
at
the
the
total?
end of round 1. I
Okay,
think
I'll ask the
we've all done
scores.
fairly well. Yes.
All right. First, just tell me, how was it? How was it?
Did you enjoy it, the round 1? Yes, we're just burning the fire. We've just started, right?
Right. All right. So let's look at the scores. So team A, E-Zone Kolkata, we have scored 30.
Well
Please put
done,
your hands
team
together.
A. Well done, well done.
Now next we have team B, West Zone Ahmedabad. The score is 20.
Well
Still
done,
we should
team
applaud.
B. Good job.
Now next we have team C, Central Zone, Mumbai. The score is 30.
Excellent. So team A and team C both at 30 so far.
Now next we have team D, North Zone 1, Delhi. The score is 10, but still we must applaud.
Keep it up, people.
We have just started.
Buck up, buck up, buck up.
Now next we have team E, North Zone 2, UP. We have score 20.
Good job. Well done.
And we have team F, South Zone, Hyderabad and Bangalore. The score is 10.
All right. So all the teams have opened up their scores. It's a close fight. And yes, because you're all the best, right? Fighting it out together. So are we ready for round 2? Okay. Dr. Sumer is going to conduct round 2.
So round 2 is going to be the round of connections. In this round, we will have, in this round we'll have again 12 questions. Each correct response will carry plus 10 marks. This time there will be no negative marking, no passing, 45 seconds for one person you have to answer. We will not be passing it to any other team. Okay, so you just need to focus on your question at a time. Are you ready? Team A, are you ready? Yes? Team A from the East Zone, let me just show you the first connect and identify image. Connect and identify. You want to come closer also, you can do that, it is okay.
Connect and identify.
Although we will not be passing it to the other teams, but if you want to, later on answer academically, you can keep looking at the image, we'll have a discussion.
So
people who are watching us on the YouTube live can also start commenting.
Comment your answers. The other teams, yes, it's a good idea to think what it is. And
time is up. Time is up. Anything you want to say? Team A, there's no negative marking. Say anything.
you have to just connect and identify. No.
Okay.
Okay,
So any other team wants to just give it a shot. So we saw the final image, the puff of smoke is.
Okay, let me ask you, what is the first image? What is Suzuki here? Are we talking about the car?
Suzuki is the staging.
Staging. Excellent.
Perfect.
Yes, excellent.
Second
What
image?
is the second image?
Ring finger
Ring
protein.
finger protein. Right, absolutely right. And the third we all know is the puff of smoke. Right? So moya moya.
Well done.
Okay,
So-
what age group do we see it? Children.
Okay.
Yes, 5 to 10 years of age. That's the most common age group. From where? Which countries?
Japan.
Yes, Southeast Asian, Japan, Korea, China. Right? Very well done.
Okay, now we go to the team B. Team B, are you ready, team B, for your direct question? Connection. You need to look at the image and somehow connect them. I just need the final connection.
Go on.
I'm sure you know it.
Go on, team B.
I am very sure you know it, Pita. I can already see in the chat box people are firing their answers.
Connect and let us know what this is talking about.
Okay, what is the final connect, Beta? What is the final connect? You can say it on the mic.
Hello, hello.
Yes. What is the final answer?
The final connect would be scurvy.
They are saying scurvy, and we totally agree.
Should we give it
Full
to
marks
them?
to them.
Yes,
Full marks.
well
Well done. Well done. What is the first scientist? Who is the first guy that you can see? Very historically important. James
Wow,
Lind.
wonderful.
Very good.
Very well done.
You can see the
Excellent.
bleeding petechiae, and what do we see in the mouth? You see gingival bleeding, corkscrew hair. Answer is vitamin C deficiency, called as scurvy. Team C, are you ready for your direct connect? Okay, Team C, ready? Okay, all you need to do is connect the images and give us the diagnosis.
Team C, go ahead, boys. I'm sure you can do this one.
Check.
There are a lot of hints in the form of images for you.
You have to just see each of these images separately and then think of the answer.
Yep. So there is a gross finding. There is some microscopic findings.
Okay, your time is now up. What is your answer?
The connect is relapsing perichondritis.
Relapsing perichondritis.
Polychondritis.
Polychondritis. Unfortunately, that is not correct. Okay.
Okay.
Any other team wants to
Anyone
just
else
give it
wants
a
to
shot
connect?
without the marks? So the
Okay, so
first
this
image
is-
is showing us, this image is all about hyperviscosity related
Can you now tell
symptoms
us?
like blurred vision,
Yes.
Waldenstrom
it is
microglum,
Waldenstrom's
and the
and
image was showing biopsy of the left ear, and the biopsy is shown to you which shows dermal lymphoplasmacytic infiltrates with numerous plasma cells. So the
there is-
answer was Waldenstrom microglobulinemia.
All right. Team C, well tried, but better luck next time. Team D, are you ready? Okay.
Okay, next direct question for Team D. Team D, are you ready? Team D, are you ready?
Team
Okay,
D.
let me show you the direct connect image. Yes.
So with some energy, you have to reply. Come on. You are going to remember this for your entire life, right? तो थोड़ी energy के साथ आपको reply करना है and
Yes, connect and diagnose.
Team D, do you want to come closer and have a look, or you're ready with your answers?
I think it's straightforward only. Team D, yes. What is your connect?
Connect is prune belly syndrome.
Correct, absolutely
Absolutely.
correct. Full 10
please
marks.
give them a huge round of applause. Wonderful.
Okay, can you tell me the triad? No, this is just like that.
Abdominal wall defect,
Yes.
cryptorchidism, and
What was the second thing?
Cryptol.
Yes, and hydroureteronephrosis, right? There's a vesicoureteral reflex. Also in pregnancy, what would be the finding? I'm sorry. Oligohydramnios because of reduced urine output. Okay, good job.
Very good, very good. Okay, so the answer was prune belly syndrome. Prune was shown to you. Intra-abdominal testes, megacystis, megaureter was shown to you. Next, for the team E, direct connect. Okay, you just need to look at the images and give us the connect. Are you ready now? This image that I wanted to show you is here. Connect them. You have to come closer, I am sure. You know, this is not.
You want to come closer, team E?
There is something which is connecting all of them. It's not tough. Don't worry, it's not tough.
So BRAF mutation.
What is the answer that you're saying? Can you repeat?
So BRAF.
Yes.
BRAF mutation.
BRAF mutation.
Yes,
Correct,
yes,
correct.
yes,
Full marks, full
absolutely
marks.
correct.
Very good.
Clap
So,
for her.
what is the first image showing us? First image is showing correctly, it is showing us Langerhans cell histiocytosis. Second image is showing that orphan NEI, that is papillary cancer thyroid. Third, hairy cell leukemia, very good. Fourth,
Excellent.
pilocytic astrocytoma. You are connecting them by BRAF mutation. Very
Good
good,
job.
very good, very good. Full 10 marks. Well done, well done. Okay, team F now. Team F, are you ready now for your direct
F?
question? Team F.
All the best.
Okay.
Are you ready? Yes.
Yes, looks like a tough question coming your way.
No, it's not tough. You're going to do it.
Okay, team F, what is your answer? When we connect them, we will just need the final identification. Yes, what is your final answer, Peter?
Yes.
So dermatomyositis,
The
proximal
Prayer sign.
okay.
Cheiropathy.
diabetic ureteropathy prayer sign, and proximal muscle weakness.
And we have some other answers.
Grover sign.
So we don't have this answer. So we'll see what any other team wants to give it a shot. Yes. Okay.
Well, all of you have something correct. There is a muscular weakness there. Yes, there is a prayer sign, which is
prayer
fine.
sign is shown. Yes, the third image is prayer sign.
But
yes.
what is the connect?
Why is that birthplace of Jesus shown in the image? Answer
Yes,
is Bethlehem
excellent.
myopathy. The answer was Bethlehem myopathy. The first image is showing us the keloids. Second is the birthplace of Jesus. Third is the prayer sign. Fourth is the rolled cake sign. Rolled cake sign. The answer is
What is the
Bethlehem
inheritance
myopathy.
pattern of Bethlehem? Autosomal dominant, right? And type 2 को पहले क्या कहते थे? Ehlers-Danlos, right? Type 2 was earlier
Sir,
called as.
can we get any partial marks?
No, I think the marks are only for the connect final.
See, that
connect,
was only
so
one of the
that's it.
signs.
Okay.
How much so I want to give it, but.
So now what we'll do is, now we will go
Start
to
the
the now we'll go to the question for team F now. We'll go with the reverse circle. Team F will get the direct question to connect again. I will just show you the image. Just be on a lookout for the image. Are you ready? Yes. You just need to put them all together. It's a very easy question.
Come on, yes. Yay.
They are saying Tempe syndrome. It is absolutely correct. You can see the first image is showing us the telangiectasia. Second shows elevated erythrocytosis. Third is showing the monoclonal gammopathy. Then you see perinephric fluid collection. Intrapulmonary shunting is shown to you. Final answer is Tempe syndrome. They get full marks. Well done.
Well done. Well done.
Okay. Team E. Team E. Are you ready for your direct question? Ready?
Okay.
I will just show you the image on your screen. It is about to come. Yes. You just need to connect them.
Come on,
it's an
you
easy
can do
question.
it.
Sir, amyloidosis.
They are saying amyloidosis and we
Absolutely
absolutely agree. Full 10 marks.
Please clap
You can
for
see
Team E.
the Rodolphe Verco on the image. The ECG shows the low voltage complexes. The shoulder pad sign is seen very good, and you can see the amyloid fibril stain pink in HNE.
Right,
Very good.
absolutely correct. So full marks to Team E. Well done. Okay, Team D, are you ready, bachas?
Team D, direct question for you. Direct question. You have to connect them. Are you ready? Team D, let me just get the image right for you. Okay, madam is asking me not to push too hard, otherwise the images will blow. Okay.
Yes, Team D, you can come closer, have a look, see what are the findings shown to you. Connect. There are so many signs shown.
Yeah. It's a very good one actually. It's a very good one. Okay, Team D, what is your answer? Direct answer. What do you want to connect them all? Time is up now. Do you want to say something?
Team D, bachas?
They're saying scleroderma and anything else you want to add?
add
We are okay with the answer, but absolutely correct. Full 10 marks. Definitely. The first image is showing you hypertension.
So proud of you. Well done.
The second image shows you modified Rotman skin scoring. You can see the anti-U3 RNP positive in the third image. Onion skinning appearance is shown in the fourth image. Proteinuria, ACE inhibitors as the first line of therapy. The answer is
Very well
sclerodermal renal crisis. Very
Proud
good.
of
Well
you.
done. Well done.
Come on, everyone, clap for others as well.
Okay, now the direct question for Team C. Team C, are you ready now? Direct question. Let me just get the image for you. It is about to come. Yes, yes, yes.
Are you ready?
It's one of my favorites.
Okay, Team C wants to have a closer look. Go ahead.
It's a very
Dr.
easy one.
Sumer is bubbling with the
Yes,
answers.
yes.
The moment he sees the radiological images,
Yes.
Don't answer, please don't give the answer. Right, the boys seem confident and they're going to come up with the answer.
I think we can make out from their walk back that they know the answer. Yes, what is your answer?
Sir, the connect is that all the tumors in this image show the central stellate scar.
Absolutely correct.
Super
Absolutely
duper.
correct.
Put your hands together
So,
for team
the first
C,
one,
central
the
zone
second
everyone.
image you see is the kidney image. What tumor do you think is that? Kidney image. Oncocytoma. The third
nice.
image is a pancreatic image. What do you see? Serous cystadenoma. And the fourth image is a liver image. What do you see? Focal nodular hyperplasia. Well
So
done.
proud
Well
of you
done.
boys, very
Well
well
done.
done. Good job.
Okay.
Plus full marks for team C. Team B, are you ready, bachas? Chalo.
Team B, let me just, I'm preparing a question for you. I'm preparing a question for you.
On
It's
the
taking
spot.
some time. It is about to come
They're
to
a
this.
smart
thing.
bunch. They'll
Yes,
be able to
it
answer.
comes.
Go
You
ahead.
need to name the maneuvers and in which they are used.
I knew you would need it.
Okay, even if you name the condition, we are okay
Yeah,
with
we
it.
are okay with it. Even if you give us the final condition.
We are
It's
okay
fine.
because, I can see the pain in your life, so we are
Time's
here to
up.
help you out.
Now you have to answer.
Yes,
Hello.
team B.
The condition is BPPH, BPPV.
Which is what?
Benign paroxysmal positional vertigo.
Perfect,
Okay.
perfect. And name the maneuvers.
First one is aptly, last one is dick sulfide, second one we are not sure but it's guhani also. Gufonism.
Okay, I think you could, maybe they're the other names.
Okay.
We will
so-
give you full marks for this one.
Wonderful.
So yes,
Please
these
put
are
your hands
maneuvers
together for
for
team B, everyone.
Well done, well done, well done. So
Team-
next, team A. Team A, are
you
you
ready?
ready? Are you ready for the connect?
on your screen.
You just need to look at the
now.
image, connect them into a single disorder.
Lots of hints for you. Team A, do you want to come and have a closer look? Oh, they seem confident. Are you ready with the answer? Go ahead. Be a little louder.
Relapsing polychondritis.
What? I couldn't make out. Can you spell it out? What are you saying?
Relapsing
Polychondritis.
polychondritis.
Polychondritis. It could. Do you have any other name for it? You want to give another name?
There are a
for
lot of
it?
images there.
We have a different answer on the
Yes.
table with us. So
Okay, what I want you to do is, can you tell me what the connects are maybe?
we see the cartilage. What else?
But the cartilage is here, not exactly for the cartilage. So, yeah. So the
Time is up.
Time's up.
Okay. Any other team wants to? You want to give it a shot?
anyone else?
Absolutely right. They are saying
Wow,
Vexas, and it
yes,
is
very
Vexas
good.
autoinflammatory
Clap for
syndrome.
team D. Right
Chondritis
answer.
was right for the last two images.
But there is lung involvement, there is vasculitis, neutrophilic alveolitis in the third image. Fourth is showing vacuoles in the myeloid precursor cells in the bone marrow. E shows the neutrophilic dermatosis. F is tender plaques. G image shows us the auricular chondritis. H is the nasal chondritis. So vacuoles, E1 enzyme, X-linked autoinflammatory somatic disorder.
I
Vexas
hate to say this,
autoinflammatory.
but we would not be able to give you marks for this one. Okay, but better luck next time, right?
Okay, that comes to the, we come to the end of the second round and we'll ask
So
our
can we have the
scorers to
scores?
give us the score.
All right, everyone. First of all, really well played. Please clap for yourself. So we have come up with the scores of round 2. And for team A, or should I start with team F? Okay, let's start with team F. Team F South Zone, Hyderabad and Bangalore. We have the score 20. Please put your hands together. Wonderful. All right. Now next we have Team E, North Zone 2, UP, and the score is 40.
Well done.
All right. Now let's go to Team D and North Zone 1, Delhi. The score is 30.
Well done.
Team C, Central Zone, Mumbai. The score is 40.
Well done.
Come on, put your hands together. Loud.
Very well done.
Next we have Team B, West Zone, Ahmedabad, and the score is 40.
Excellent. Very well done.
And Team A, East Zone, Kolkata, we have the score 30.
Keep it up. Well done. So it's a close fight. We are
And
all
the competition is also
almost
getting tougher. Let's see. Let's go to the next round.
So the next round is called as the house round after the famous House MD.
And you know what you have to do.
It
We're
is
going
going
to
to
talk
be a
about some
case.
cases.
Yes, it is going to be a case round. We have total of 12 cases with us. Each team gets 2 questions. One will go A to F, second will go F to A. Correct answer plus 10, time limit 1 minute, no passes, no negative marking, no pass, no negative marking. Quiz master decision will be final. After the first 6 questions, if all the teams feel we might, if you all say कि इसको pass में लेके जाना है, then we might do a buzzer thing in the last 6
For the
questions.
second round,
We'll see. पहले एक बार we'll go on the A to F cycle. Okay.
So Team A, the first question will be for you.
Let me just show you the question on the screen. If you want to come closer, you can come closer as well. Let me just show you the question. It's going to be a clinical case. There will be some time required to read it. I'm just opening the question. Yes. 75-year-old male, difficulty while walking for 2 days. During walking, episodes of jerky movements in right arm and leg, slurring of speech. Episodes last for 1 to 2 minutes, completely recover and recur on exertion but not on rest. 3 to 4 episodes per day. No aura, no incontinence. Known case of diabetes, hypertension in 12 years, not improves with carbamazepine. BP 135/75, other vitals are normal. MRI, EEG are normal. If you have read this, I'll tell you what you have to answer.
I will show you what you have to answer.
That's the question. Okay, and the question that I have for you is, you have to identify the presentation and tell me this classic presentation is pathognomic of which condition? Okay, I'm going back. Okay, I'm not touching it only. Identify the presentation and the classic presentation is pathognomic of. Okay, see it once only because.
To answer.
Identify the presentation and what is this classic presentation pathognomic of which condition? He has difficulty in walking, episodes of involuntary jerky movements in the arm and leg, slurring of speech, completely recover, reoccur on exertion. Time is up.
Hemibellismus in subthalamic nucleus lesion.
He's saying hemibellismus, subthalamic nucleus lesion. We say incorrect. Anybody else wants to give it a shot? No marks, but do you want to give it a shot?
It's something to do medial temporal sclerosis, something.
Anybody else wants to give it a shot? 75-year-old person is there. The answer that we were looking for is called as limb shaking transient ischemic attack, which is associated with severe carotid stenosis. So we don't give you any marks here. We go to the team B now. Team B.
Are you ready, Team B?
Right, so let's see your question. I'll speak out the question for you and then we'll ask you what we need you to do and then we'll show you the question again. A 27-year-old Nalli Gravida presents to you with 6 months of amenorrhea, 5 years of infertility. She attained menarche at 11 years of age. She has regular 28-day cycles. There is no history of dysmenorrhea or passage of clots. There are some investigations I want to show you. So if you are done with this, I'll show you the investigation. So in a nutshell, amenorrhea, history of infertility with regular menstrual cycles. Ready for your investigations? Okay. The height is 165, BMI is 20, there is no organomegaly. On speculum exam, the vagina looks dry. The semen analysis of the husband is normal. UPT of the patient is negative. The weight is 55 kgs. The breast, thyroid, external genitalia, everything looks normal. Ultrasound shows a normal uterus. Ovaries with antral follicles measuring 11 mm in both ovaries are noted. Yes? We have some more investigations for you. These are her hormonal analysis report. Look at the TSH. FSH is 80, LH is 65, prolactin is 12, AMH is 6.5, karyotyping is XX. What is the diagnosis? Team B? Okay. So remember the question was nulli gravida with amenorrhea and infertility. Yes? This is the hormonal evaluation. Look at the key findings, write them down, then connect the dots. These were the previous findings. We've given you general examination, we've given you ultrasound examination, and I want to really say it out.
Okay, any answers, Team B? We can see some vigorous
Team B?
discussions happening in their
Team B,
paper.
Team B. Bachas? Yes. Anything that you want to tell me?
Time is up. So time is up. Okay. Any other team wants to give it a shot theoretically?
They want to say something. Yes,
They want to
Team
say
B.
something. Okay, you want to say something.
Polycystic ovarian syndrome, PCOS.
They're saying PCOS. Okay.
No,
Not correct.
that
Not
is
correct. Not correct.
incorrect.
Any other
Okay.
team wants to give it a
So
shot?
since they said PCOS, did you focus on FSH levels? Are they normal? They are really very, very high. Do you see these high levels in PCOS? No, they're absolutely normal levels of FSH.
Is it pseudocyesis? Like
What is?
pseudocyesis, false pregnancy?
No. Anyone else who wants to give the answer?
Yes, team F would like to.
Primary ovarian and
No.
Nope. Again, no.
Something they have given ovulation induction.
So let's see. She said POI, right? Primary ovarian insufficiency. Why is it not POI? Because in POI there should be no follicles, bacha. The ovary should not have any follicles. This is a normal looking ovary which has follicles, but the FSH levels are high. What is it? It is resistant ovary syndrome. Presents as secondary amenorrhea. The LH-FSH levels are very high. All other examination is normal. How do you differentiate from POI? I said ultrasound will not show you follicles in POI, but in here the ovary is normal, right? So you will see follicles. The ovary is just not responding. And yes, it is an important question to differentiate from PCOS, to differentiate from POI. Why did they think of POI? Because we had described dry vagina. Yes, but the reason for dry vagina here is ovary not responding rather than an ovarian failure. Okay, so remember this is resistant ovary syndrome, was earlier called as Savage syndrome. Okay. Great.
Okay, so next question directly for Team C now. Team C, are you ready for your the house round question? Ready? On your screens, I am about to show you a clinical picture, then followed by a radiological picture, okay? This is a 45-year-old non-smoking farmer with no pre-existing illnesses presented to emergency room with dyspnea, leaving his work halfway. Complete hemogram had marked leukocytosis, neutrophilia, lymphopenia. ESR elevated, IgE levels are normal. Are you through with this slide? Ready?
Have you written the keywords?
Okay. So now I'll show you the radiology. Chest X-ray shows bilateral interstitial infiltrates that progress to bilateral alveolar infiltrates, bronchocentric centrilobular nodules, ground glass opacity, mosaic-like attenuation, what could be the probable diagnosis on the image? The keywords have already been given to you.
Do you want us to show you the previous slide again? Okay.
Okay. It's very risky to change the slides. Okay. So are you ready with the first slide? 45-year-old non-smoking farmer, no illness, leukocytosis, IG normal, ESR elevated. I'm showing you the radiology. Centrilobular nodules, ground glass opacity, mosaic-like attenuation on HRCT. The time is almost up.
The diagnosis farmer's lung.
Do you have a better answer with you?
Do you want to?
Farmer was written in the question only, so we want a better answer than that.
Like it is secondary to thermophilic actinomyces.
Okay, so I don't think we can give it to you. Anyone else wants to give it a shot so they don't get any marks? They don't get any
Any
marks?
team who wants to try the answer?
It is a clear-cut case of hypersensitivity pneumonitis. The answer is hypersensitivity pneumonitis. What is the CT finding that we were seeing? What was the CT finding? CT was showing the head cheese sign. The patient is a farmer by occupation, non-smoker. There is no type 1 hypersensitivity. That is why IG levels were normal. IgE is normal. No eosinophilia. Head cheese sign. Head cheese signs means there is mosaic attenuation, ground glass. All three kind of opacities are seen. And you could see pulmonary infiltrates in the reticulonodular pattern. The answer was hypersensitivity pneumonitis that we were looking for.
So, but farmer's lung is a hypersensitivity reaction to the mold.
No, but we can't say because the farmer word is already there in the question.
We wanted the answer as hypersensitivity pneumonitis.
So we can't simply say farmer's lung. Yes.
So team D, now the direct question for team D now. Team D, are you ready? Okay, it's a shortest question. There's a direct image visible and there's only one image in the image.
Are you ready, team D?
Yes. 20-year-old male patient has painless bilateral progressive loss of vision. Visual acuity on right and left eye is 20/60. Anterior segment examination is normal. Fundus is shown below. Amsler grid gives equivocal result. EOG normal. Dark adaptation prolonged. What is the most likely diagnosis that we are looking for?
Stargardt's disease.
Absolutely correct.
Right.
This is
Wonderful.
Stargardt's
Please put
disease.
your hands
This is
together for
Stargardt's
team
disease.
D.
Very good.
Very
Very
quick.
well done.
And this is an inherited disorder of the retina causing visual loss during childhood and adolescence. Fundus picture reveals lipofushkin deposits. Very good. I think they got it absolutely right.
Excellent,
Very fast.
team D. Keep
Excellent. Full marks. Full marks. Okay.
done. Okay.
Now team E.
Are you ready?
Let me just see the number of images. Okay. I have only.
Yeah, that's it.
Okay. Okay. I have just one page for you. So team E. Are you ready for your question? 26-year-old married, short-statured woman presented to EMS with pain and swelling right lower limb after trivial trauma. No children despite unprotected sexual intercourse. History of seizures, episode in the past. Paresthesia, ataxia, occipital headache for 10 years. Hemoglobin 9 gram. PS shows Howell-Jolly bodies. Low albumin, low vitamin D3. What is your diagnosis? We need the final diagnosis. Team E. Team E. Team E is trying.
Team E.
Any answer you want to give? I think this was a tough one. Okay. Any other? You want to close it? Team E. Is the time up? Almost up. We have time. We have time. Keep thinking. Time is up. Any final answer?
So part syndrome.
Part syndrome. Okay. So any other team wants to give it a shot?
Yes, team B.
Is it PTP?
TTP? No.
So-
Anyone else?
This patient actually has a atypical celiac disease is the answer. There is epilepsy, occipital calcification visible on the CT scan.
Okay, what is anemia and Hobble-Jolly bodies telling you?
In the question are
Hyposplenism. Right?
There is short stature osteoporosis are explaining the fractures, and infertility, ataxia, peripheral neuropathy. Both silent and latent celiac are asymptomatic. That is the answer that we have with us. So now we'll go to our
Team F.
direct question for Team F. Okay, Team F, are you ready? There's some important thing, that is why we are smiling.
Team F,
so
are you
Team
ready?
F, are you ready? Okay.
30-year-old female presents with bilateral BP red violaceous rash over ear pinna, vertigo, hearing loss for 2 weeks. There is history of nasal stuffiness, rhinorrhea, epistaxis, and saddle deformity. Asymmetric oligoarthritis. There is chest pain for 2 days. There is scleritis. There is hoarseness, non-productive cough, tenderness over larynx. Anti-matrilin antibody is positive. What is your diagnosis? And we share
Yes, Team F, what is your answer?
some emotions here. Team F? Everyone else, you need to stay mum. Team F, are we ready with the answer? Yes?
Okay, Team F, what is your final answer? Huh? Time is up. Overlap syndrome is not what we are looking at. Any other answers? So we were smiling because
Yes.
so many times this answer has been given.
People have said this
Finally, we
answer.
had
Finally
the
it
relapsing
came.
polychondritis, auricular chondritis, non-erosive arthritis, nasal chondritis leading to a saddle nose shown in the image, ocular inflammation mentioned in the question, tracheobronchial involvement, anti-matrilin 1 antibody. So the answer is relapsing polychondritis.
Okay, to make the next round a little interesting and involvement of everyone, we will convert it into a written round. So the questions will be for everyone so that you're all alert and we're all putting our thinking caps on. We'll come and check answers. Whoever gives it right will get +10. So it's an opportunity 6 times more to secure your marks. Are you ready? Now everyone is excited.
We're doing it just to, eliminate any luck factor in the quiz.
So are we ready for the first question, bachas? Okay. So this is the first question for all of you. 26-year-old primary gravida, no known comorbidities, underwent a cesarean section under spinal anesthesia for failed induction. Patient had a heart rate of 120, which is attributed to blood loss. She's planned for blood transfusion. After about an hour, she developed sudden onset of breathlessness. Examination for patient is dyspneic. The oxygen saturation is low. The urine output is low, 10 cc per hour. Auscultation shows bilateral crackles. There are no murmurs. The sign is tachy. Quick focus shows bilateral profile. Echo. Global hypokinesia with a left ventricular ejection fraction of 35 to 40%. What is your diagnosis?
Okay.
Please, mera naam
So-
roshan karo.
Yes, I'll have to come and check the answers as soon as you start pressing your bells. Are you done? Okay, let me take a paper because...
Everyone needs to write. No negative marking.
Okay, let me just see. Yes. What is your name? Okay. Okay, beta. What do you think? I don't know what is it. Okay.
Let's see who will
Okay.
got this.
I think many of them are getting it. Okay. So I think A, B, C, D and F. They got it right. They got it right.
Right.
And they
So
directly
A-
they have the answer
Wait,
that you
wait,
have
wait.
with
A,
us.
B, C, D,
F.
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 E, why were you ruled out? Okay, anyways, what is the answer, people? Very, very nice. So now, yes, the answer is peripartum cardiomyopathy, but I have a question for you. Why is this not AFP? Amniotic fluid embolism. There was sudden onset of breathlessness. Why is it not? Yes. Yes. So there is a global hypokinesia. That's one hint. What else? No evidence of DIC. Right? A very characteristic combination for AFP, and this is a very potential question for all exams. You should know how to differentiate AFP from peripartum cardiomyopathy. Okay, my last question to you. Peripartum cardiomyopathy is seen from what time to what time? 36 weeks to 5 months. And most commonly seen? Yes, actually in the first week itself, right? So, may not be actually immediate, but yes. Very well done, teams. I'm proud of you. Good job.
Wonderful.
Done.
Clap for all.
So we give +10 to all teams except E, but no worries. We have more opportunities coming your way.
Okay, so next question I'm going to read out for all of you very fast. Let us do it. 10-month-old infant brought by his mother with complaints of abdominal distension for 1 month. Boy is active on examination, no pallor, no icterus. Large head circumference plus 2 standard deviation for his age. Wide open anterior and posterior fontanelles. On evaluation, TSH levels were raised, free T3 and T4 were reduced. Have you seen it? Should I show you the next page?
We need to show you some examination
Okay,
findings.
10-month abdominal distension, 1 month, large head circumference, wide open anterior posterior fontanelle, TSH raised. Are you okay with the idea? Okay. On examination, multiple small masses were palpable, soft inconsistency. His penis shows the following finding. Endoscopy is shown to you.
You have to tell us what is the diagnosis.
It's a tough one. I think Madam
Okay,
is
you can
just going and check it.
Yeah, I'm coming over and I'm going to check your answers. Okay.
We need the full answer, complete answer only, then we'll give you the answer marks. Okay.
Okay, I'm coming over. So which team pressed the buzzer? Okay, I think
team B rank it
B
first.
and I think E. Okay, what is your answer? All right. Yeah. Okay, you're trying to spell it out just in case ma'am doesn't know. Yes, ma'am knows more of OBGY but less of other things. Anybody else ready with the answers? You want? Okay.
It's team F.
I'm here. What is your answer? Okay. Yes. Are you ready? You're just trying, which is okay. That's why we are here. Yes. Okay. Team C. Okay. Yes. Theories. All right. So I think everyone has submitted their answers and we have correct answers by yay Team B, yay Team C and yay Team E. Okay?
So B, C and E have got it
Wonderful.
correct.
Please put your
Yes.
hands together for
So what was
all
the
the 3
answer that
teams
you guys gave?
who have answered it correctly.
Okay, so before we get the final answer, so this first image, the initial history was showing us macrocephaly and hypothyroidism were evident from the first page. The second images were showing us penile pigmentation and GI polyps. We put them all together with P10 mutation. The answer that we were looking for was Banyan-Riley Rubalcaba syndrome.
So
Multiple
very
GI
well done.
polyps,
Excellent
macrocephaly, this
Wonderful.
tough one,
Clap for
hypothyroidism,
the winning
penile
teams.
pigmentation,
Come on.
P10 mutation. Well done.
Shabash, shabash.
Well done.
Very
Shabash,
nice.
shabash.
Okay, are we
Okay.
ready for the next one? Okay, there's yet another opportunity for everyone to get +10. Let's see. A 10-year-old boy came to casualty with loss of consciousness after an episode of sudden involuntary movement, uprolling of eyes, tongue by, right side facial sensory motor symptoms, hypersalivation. The child's parents revealed the child had similar episode infrequently for past 6 years. The examination shows stable vitals, normal electrolytes, a normal MRI, brain. I want to show you some findings. So if you have taken down the keywords, I can always come back to this slide. These symptoms spontaneously resolve after puberty. The ECG is shown below. Bachaji, what is your diagnosis? So we have the ECG here. We have a hint that the symptoms will resolve after puberty. I'm going to go back to the question for you. And you can start writing your answers.
Okay, anybody wants me to come and check the answer? They want to see the ECG,
Yeah,
you know.
sure.
They want to
EEG.
Okay, if they want to diagnose by the EEG, very good.
You want me to go back to the question as well? No, you're good? Okay. Where
Okay.
we have the
Team E and F. Rang the bell.
Yes, Team F, what is your answer? I have some other answer. Huh? You want to write clearly, I see, huh? Okay. Yes. Any answer? No.
Team C, have you written something? Okay. Team B?
No. We have a very specific answer that we're looking at. Anyone else wants to write the... I think we have some other thing written there, but I don't know. Let's see. Okay. So the answer that we are looking for is...
You want to say
Team
something?
E has
no,
got
wait.
it.
Team D wants to show you something.
Team? D, okay. Yeah, Team D has written something. Okay, I'm not. What is this the one now that you're saying final one? No? Which one are you saying final? Okay.
Dr. Smith, please bring your farra back.
Yeah. It's a very complicated question. So Team D and E have got it right. Team D and E.
Team
Yes.
D and
Team
E.
B and G. Please clap for both the teams.
D and E, what have you written? Let us know. Yes.
Ronaldic seizures. Answer is Ronaldic seizures.
So Rolandic seizures, self-limited epilepsy with centrotemporal spikes, tangential dipole, typical age group, and it improves after puberty, right? So the answer is Rolandic seizures. Okay, everyone, are you ready for the next question? Put your thinking caps on and we have the next question for you. 70-year-old male with acute episode of red blood per rectum, dizziness, fatigue, abdominal pain. There is no fever, no diarrhea, no prior GI bleed, no underlying coagulation defect. He is a known hypertensive. There is history of testicular pain treated outside recently. Peripheral pulses are weak, cold extremities. The urea and creat values are given to you. Hepatitis B is positive. The other HIV and HCV are negative. I want to show you some other findings. So if you have taken down the keywords, can I change the slide? Okay, upper GI endoscopy shows grade 2 varices. Colonoscopy shows copious amount of blood in the colon. Biopsy shows fibrinoid necrosis from the colon. Renal biopsy has been shown to you. What is your diagnosis? Okay, do you want me to go and check?
Okay, I'll just check. Okay, ready. Okay. I think you're on the right.
Keep showing your answers.
What is your answer? Yes. Okay.
So team, confident with your answers?
Okay. Okay. Only one team is left. Let's see what are they saying. I think. Okay. All of them have correct. All of them have the correct answer.
Amazing. Please
Well
clap
done.
for all the
Clap
teams.
for
Well
all
done.
of you. Excellent.
So the answer is polyarthritis nodosa, PAN. Everybody got it right. There were episodes of abdominal pain,
So they all know
episodes of fresh bleed, HPV positive, renal involvement, hypertension, and testicular pain were the hints.
Okay. I think we have one more question.
Okay, so let us look at the next question. 50-year-old male, chronic alcoholic, last bout of binge drinking 3 days back. Decreased oral intake for last 1 week. Presented with acute onset, drowsiness and confusion for 2 days. Spot dextrose was given in the emergency 80 mg%. Acute treatment started with IV fluids. He deteriorated on the 3rd day after admission. MRI was done on day 4, will be shown in the next slide. Are you ready for the next slide?
Okay, first
Okay.
we have some investigations for you and then we'll show you the MRI.
Yes. Are you ready with the question? Okay. These are the investigation. Look at the investigation at the admission and also given at the day 2 of admission. You might want to come closer and read it if you are not sure, but
They are
I'm
all,
sure you will appreciate MRI is going to be tough for you.
Okay, they're all better than Dr. House. Come on.
So hemoglobin at the admission is given, TLC is given, urea creatinine is given, sodium potassium is given, SGOT, SGPT is given for at admission day 2, and ALP levels have been given.
We are going to show you the MRI findings
Have
now.
have you seen the lab findings? Okay, these were the lab findings. Are you done with it? Yes, so these are the MRI.
What is your diagnosis? You want to come
So you can, the
closer?
axial and the coronal MRI images of the brain have been shown to you. To help you, I am adding a line. These are the FLAIR MRI images showing you.
Okay, once you are the previous slide, yes, for sure.
Okay.
And then you can start writing your answers.
You
and
can
I'll
start
come
writing
and
your
check.
answer. Should you want to see the MRI again? Okay, you want to see the MRI again?
Okay, meanwhile, I'll come over and see who's pressing the buzzers and calling me. So who do I go to first? Okay.
Okay, let us see who is getting the answer correct.
Let me know. Okay. Who else is ready with the answers? Okay, yep.
Team E is also ready with the answer.
Okay. Yep. Okay. Who's left? You haven't shown me still? What is your answer? Where is the answer? Okay. Okay.
Let's see who got this.
All of them except E gave the correct answer.
So,
yes. So,
so the clue was actually in the slide 1 that I showed you. The sodium was low. The sodium was low, and the MRI image shows abnormal signal in the basal ganglia, thalamus. Is all signs of extrapontine osmotic demyelination syndrome
So well
due to
done.
rapid
Let's
correction of
Explore for team
hyponatremia,
A, B,
chronic
C,
alcoholism,
D,
and
F.
malnutrition were the
Yes.
clues.
A, B, C, D, and F. Everyone gets plus 10.
Okay, the final question of this round.
Are we ready? So one more opportunity for everyone to score plus 10. 46-year-old male mine worker has come because he has noted his partner has noted him to be more muddled than usual. He complains of poor balance. He drinks alcohol at 30 units a day for past many years. He has also had a portosystemic shunt. There are postural tremors. There is broad-based cock-walk gait, disoriented from time and place, elevated ALT, low albumin, ultrasound shows ascites, MRI, bilateral symmetrical T1 pallidal hyperintensity. I want to show you the MRI images. So once you're done, let me know. Can I show you the image? And then I can come back to the slide. So this is the MRI slide. You have to tell me the diagnosis. I'll show you the question again. Meanwhile, if you have the answer with you, you can start writing it and I would come over. Yeah.
Mine worker and more muddled than usual, poor balance, drinks 30 units alcohol a day for many years, history of portosystemic shunts, elevated alanine aminotransferase, low albumin, ultrasound shows ascites, MRI shows symmetrical T1 palatal hyperintensity.
Come on. You can all start writing answers. Anything that you can think of? Okay, are you ready? Yeah. And there. Yes, team A. Oh, what is it? Okay. Anyone else ready with the answers? There are no negative markings. Sumit, can you show the stem of the question, please?
Okay, beta.
Anyone else? So I think only team A has submitted an answer. Okay. Okay. Anyone else? Which team was that? Okay. Yours. Yes. Which one, bacha? Okay. Anyone else? Okay. Yes, please. Okay. And this is the answer?
I don't think anyone will get it, so
No,
I'm not
none of
even
them.
moving only. So
Okay.
the final
Since
answer that we
nobody
have
has-
is,
No, wait.
Team D wants to say something. Yes. I think they have calculated some answers from their problem, so they might come up with an answer.
Okay. Okay, okay, we cannot have repeat answers now.
So I am sure you can appreciate the question so far is telling us there is a liver disease and a portosystemic shunt appreciable in the clinical
Okay,
problem.
what is this?
And the MRI shows increased signal due to
Mine worker. Does that give you a hint?
the answer was
Almost
there
everyone has
is
said hepatic NSF. It's not hepatic NSF.
manganese toxicity. The answer that we had is manganese toxicity secondary to the liver disease, secondary to the portosystemic shunt, associated with liver cirrhosis, polycythemia, SLC39A14. Like that is the answer we have. Okay. So now what we'll do is we'll look at the scores at the round of
And
three.
also,
at the
which
end of
team
the-
has got the right answer in the
None,
last?
none of
All
them.
right. Okay.
And before we go on to the next round, which is going to be the fast and the furious, the
Yes.
buzzer round.
So now we have some fast rounds. Do you want me to be there with you? Yes. Of course, yes, we can.
I think we can do the break after the round of round 4, if you suggest. It's a very easy round. Okay, go.
So I will be announcing the calculative scores of all round, and there's how we will know that which team is leading already. So we are starting with the team A, E Zone Kolkata. So the total score is 60. Please put your hands together for team A. Now let's head on to team B, West Zone Ahmedabad. And the score is 80. Please put your hands together for team B, everyone. Wonderful. Now let's start with the team C, Central Zone Mumbai. And the score is 80.
Very
Please
well
put your
done.
hands together.
So team B and C are fighting it out.
Yeah. And also team D with the score of 80.
Wonderful.
Competing with team B and C.
Team D.
North Zone 1.
Has come
Delhi.
forward with leaps and bounds. Well done, team D.
Alright, now let's start with the team E, North Zone 2 UP. And the score is 70. Not bad.
Wonderful.
Put
That's
your hands together.
Great.
And I can't find anyone from team F. Anyone from team F?
They are coming. Yes, we can hear the scores for team
Yes.
F. We're excited.
Alright, so the score is 50.
Okay.
Please put your hands together for team F.
So which means all of you are really neck to neck.
Yes,
right?
and
It's a
also
very,
team,
very closely fought quiz.
team B, C and D are competing with the
But
equal
others are not
scores.
far behind. So, now we have the buzzer rounds, which is going to be a great opportunity again to, take the leap. Okay?
Usually we have seen over the years that it is in this round that the game changes.
And you have to be very, very alert for this round because whoever rings the buzzer first.
No.
Because the buzzer will sound the same, so what we'll do is we'll have Kanika and madam, and I think
I will
2-3
also
people
do
will
what?
be there. So what we'll do is, they will all keep an eye on you. Keep your, all your eyes on them. So one from a distance, one from close. Okay. So what you have to do is, if you want to press the buzzer, instead of putting the bell, you will have to raise your hand. One person you can nominate in your team, or maybe anyone can raise your hand and say team C, team C, team D, like that. You say your
You have to say
team,
the alphabet of your team.
or you
right?
can say C. You can say D, like that. Okay. You can name your team. Name of your team and raise your hand. So speak and raise your hand at the same time, so that we can identify who is getting it right. So is everyone in the team back?
No, team F is not
Team
here
F is yet to come back. Okay. I think they must be doing some final revision. At the end of the round 4, we are planning to
So
have a
since
lunch
all
break.
of you have come from different places, please tell me, what were you doing when you were traveling here? Were you reading? Yes? Please don't say you were reading. Were you sleeping? That's the good thing to be done. Okay. So you were rejuvenating your mind so that it's active and sharp.
Alright, so team F is here. So people, we have revealed the score. Your score is 50. And we have
And
3
you're
leading
close.
teams.
You're close
Yes,
to others.
yes. And we have 3 leading teams, team B, C and D with the score 80. Okay,
Now we
so
have the buzzer round, but instead of the buzzer, if you know the answer, anyone from your team can raise the hand and say your alphabet, A,
F,
B,
F.
C or
You
F,
have to say
whatever.
F, or somebody will say
Right?
E, like depending. Okay. So people are observing you. We will take the decision as final. The rules will be this round total 25 question, time limit 5 seconds you have to answer once you press the buzzer, plus 10 for the correct answer, minus 5 for the wrong answer, no pass. Quiz master decision will be final. Now, after I finish the question,
Wrong answer,
you have to
minus
then raise the hand. Okay. Are you ready? Are you ready? All of you? It is not going to get passed. The question is expired.
There's no pass.
Yes.
Yes, let us read out the question first.
When I say the last letter of the question, then.
Acha, okay, you do it whenever you want.
Okay, you can do anywhere.
Let's have the
Okay,
Jungle Raj.
ready. It's Jungle Raj. Ready. Survival of the fittest. Name the normogram. No one. Team C. Which team? Team C. Yes, Team C. Can you speak on the mic? We can't hear you.
Martske nomogram.
Martske nomogram.
That's right.
Correct. Well
Okay,
done.
just a minute. Before Team D, you were raising your hand, but you weren't saying D. So please do that because people will not be able to hear you. Yes? Okay? Your reflexes.
Okay, it's a tough one, but I'm sure you can do it. Okay, so you will have to give both the answers. Okay, in this both the answers you have to say. Okay, before you raise your hand. Okay, ready? Okay. Expand HEMPAS and it is seen in which type of CDA? Team C. Yes.
Hereditary erythrocyte multinuclearity with positive acid lysis test and type 2 CDA.
Perfectly correct answer. Hereditary erythrocyte multinuclearity positive acidified serum lysis test. CDA2. Perfect.
Team B, I have a recommendation for you. Can you lower your masks because then you will be heard better, bacha. Yes? Just for this round, baby.
Okay. Okay, are you ready now? Identify the procedure and the sequence in which it is done.
A for sure.
He's saying tips, -5. Okay, anybody else wants to just try, just for the academic purpose? She's saying, Vippals, I am taking marks but not giving you back also. No, this is not correct. Okay. So what we are looking at was orthopedic liver transplantation sequence of suprahepatic, infrahepatic, vena cava, portal vein, hepatic artery, common bile duct to duct, and anastomosis. Okay, next image, coming your way. Ready. 14-year-old male. Strong anti-emoji, strongly positive. Yes,
okay.
yes.
Team D.
Team D. Yes, what is your answer?
Can you expand? Yes, you're right. Yes, cystoid
Perfect.
macular edema. Very
So correct.
good.
The answer is steroid-related cystoid macular edema.
Okay.
OCT was showing the same. Okay. Okay, I'll do it. Ready? I think at the speed which we are going, I think there's no time to read only. So I'll just show you the question only. No time to read only. Ready?
Two-year-old boy taken to the hospital with complaints of...
Team D.
Yes,
Okay.
that's right.
So the correct answer is diarrhea sign, urticaria pigmentosa, cutaneous mastocytosis. They got it all right.
People, you need to be fast.
Okay. Next, I want you to look at the image, but there will be two answers here. I want both the answers, otherwise I will cut the marks. Okay, so be very careful when you press the buzzer. Okay, ready? Identify the logos shown to you.
Okay, hold.
Which one?
C. I also heard C first.
The National Iodine Disorder Deficiency Control Program and the NCP-DCS, which is the National Program for Cardiovascular Disease, Diabetes and Stroke.
Perfect. Super. Full marks. Well done. So the iodine deficiency program and the cancer, diabetes and cardiovascular stroke prevention program. Very good. Okay. Ready? Now again the next question will have two answers. So be very careful before you raise your hands. Okay. Okay. Oh, it's not working. Oh, it's working. Yes. We know the connection between superior and inferior mesenteric artery is called as arc of Roylan. What is the connection between A,
Celiac.
B?
Okay. We need two answers. So which is the first one that you're giving us? Okay. And? So you have got one correct and one incorrect.
So I think we'll show the answer, then we'll decide.
So what we'll do is we'll not give you any marks, but we'll also not give you negative marks.
Between the gastroduodenal and superior mesenteric, it is the Bahler, and between the right and left gastroepiploic, it is Barco.
So neither plus nor minus for you.
So we'll give you 0. Okay. Ready? Okay. It's like again I will just show you the image and question and then see. Are you ready? Okay. 21-year-old female, past history of HSV encephalitis. Team E wants to answer. Yes.
A. Team E. Okay.
E. Yes, E.
You need to be louder. Okay.
Okay, Team E. What is your answer? Yes.
HSV encephalitis showing plate.
Showing what?
Epileptiform discharges.
Unfortunately, I will not. In fact, I'll deduct marks. Okay? Because HSV encephalitis is already written there.
There's something else that we want as answer. Anybody wants to just give a academic try? So what we have as the answer is NT-NMDA encephalitis. 27% of the patients with HSV can present as NT-NMDA encephalitis within 3 months of treatment of HSV. Yes. Okay. So next I have a very interesting question. One of my favorites. Ready? Are you ready? Okay. There is no history, only an image.
Just an image for all of you.
I can see the shoulders already moving forward. Yes. Okay.
Okay, wait. I think I heard B first.
B. Everybody agrees it is Team B. Everybody agrees it is B. Yes, B. Then B. Yes, Team B.
Cleidocranial dysplasia.
Perfect. The clavicles are not visible. Perfect. It is cleidocranial dysostosis, absence of clavicle, large head, large fontanelle, delayed closure. Okay. Now I will show you two images. Again, I am telling you.
Both answers should be correct.
We need A and B, both answers. If you raise your hand and you give incomplete, this time we'll have to deduct. Okay? Ready? Identify the life cycles A and B.
C. Undoubtedly C. Yes, C.
Which one? What are you saying?
A is Nipah virus and B is Japanese encephalitis.
So, Unfortunately, only one of these is correct, or usme bhi the identification is wrong.
Okay.
Okay.
So
Actually,
what is the
B
first one is
Nipah,
showing us the monkeys and second is showing us the pigs.
Ebola.
First one was the Ebola, second we have is the Nipah virus, the pig.
So no plus, no minus. Okay.
Okay. Next one, again there will be two images, two answers. Ready? Identify the stain and where they are used.
B. We are all of the opinion B. B.
Perfect. A is the Mauritius Scarlet Blue, B is Warhoff Van Gossen. Perfect answers, well done.
So we are all standing at different places, okay, and we are not discussing which team. So it's a unanimous thing, and then only we say which team, okay?
Yes. So we have multiple people observing you to keep it fair, okay, don't worry. Okay, I'm getting ready for the next. Again, two answers are there. Identify the organism and mention their approximate size of the oocyst. Team F. Yes, Team F. Finally, they press the buzzer. Yes.
Isospora.
Yes, and A and first one.
There are two answers.
Size 24 micron.
No,
size is
okay.
24 to 26 approximate.
But there were two organisms, right?
Okay, so first one was, I will say both, ma'am. Cryptosporium, cyclospora, we can't differentiate. If we give size, we can tell, ma'am, but with image, yeah, cyclospora and isospora.
Perfect. I think we give it to you. Cyclospora and isospora are the answers. Well done. We are very happy with you. Okay. Are you ready? Now, I will show you one more important question. Something that I like asking all the time. There will be a... are you able to see the image? What happened? The buzzer is not working? What happened? कौन देख रहा है?
Can't see. मैं
अच्छा
देख रही हूँ, don't worry,
are you okay, ready. Next, I'll show you a PET scan image. You have to identify the condition. Identify the PET and the condition. Anyone wants to give it a shot?
You want to give it a try? Okay, I think we'll give the answer then.
Okay, so there you can see there is reduced metabolism in the posterior part in the occipital lobe, but the cingulate island is preserved. This is called as the cingulate island sign. This is seen in a dementia in which you have visual hallucinations called as dementia with Lewy bodies. The answer is cingulate island sign, dementia of Lewy bodies. Next, I will show you an image which I am sure you know. So be on your marks.
And there are three answers, okay, very simple ones. So please take a second to, because we want all answers. Okay?
I think they can do it. Okay, it's okay. Ready? Okay, 1, 2, go. Identify the sign and the condition. Okay, the time is up. Anyone? So what you could see is the turtle back sign, hepatic schistosomiasis, perivotal fibrosis, liver cirrhosis and calcification. This was the turtle back sign of schistosomiasis. Okay. Next is a question where multiple images will come to you. It is going to be a congenital infection. You just need to tell which one. I think D. Team D, what is your answer? CMV, absolutely correct. This is cytomegalovirus, ventriculomegaly, periventricular calcification, hepatosplenomegaly, hyperechoic bowel, placentomegaly. Yes. Okay, easy question. So everybody please be on a lookout. Yes. Which stage of acute pericarditis shown below?
You have to tell us a stage.
You want to come closer or so you can try? Time is up. Okay, let me give you a hint now. There is a finding in the ECG which is giving us the answer. Anyone? So the ECG shows us the T wave inversion. This is stage 3 pericarditis where you have the diffuse T wave inversion. Okay, next question is a longish question. It is going to be about a drug recently approved by FDA. Reason I am not showing is because you will pounce on it. Recently approved by FDA for treatment of arthropod-borne diseases, progression of which is depicted below. The disease is shown to you below. It involves the CNS prevalent across large areas of the dark continent. Name the drug.
Anyone?
So what is the disease? And the time is up. So disease that we are looking at is trypanosomniasis, and the drug that we are looking for was fexinidazole. Okay. Okay, next let me show you the question, and we have a, okay, next there will be 2 pages, so don't answer at the first page. There will be 2 pages at the question, so don't answer at the first page.
Oh God.
Okay, 15-year-old pre-menarchal girl had a 4-day history of increasing abdominal pain. Medical history is unremarkable, not sexually active. Physical examination has a palpable, non-tender, non-pulsatile midline mass from pelvis to umbilicus. Declined vaginal examination. Abdominal ultrasound shows large pelvic mass of uncertain origin. Uterus could not be seen ultrasonographically. Now I'll show you the image and then you have to give the answer. Okay? The question is, what is the diagnosis here?
Time is up.
Anybody wants to?
It's not a difficult one. Anyone?
Yes, Team F.
No. It is a case of imperforate.
Imperforate hymen. It was, I think, we thought you would get it very easily, but you know. So the image is showing us the imperforate hymen hematocolpometra.
Because instead of amenorrhea, it said premenarchal. Yes?
Okay. So
Just
next I am getting it ready. There is just only an image. So be ready. There's no history, nothing. Only an image. Only the image. Okay, okay. Ready. Okay. What is the image showing us?
B undoubtedly.
I don't think so. Look at there were 2 images. -5, huh? -5. Okay. 2 image है ना बेटा, वो दूसरा भी तो देखना था ना. Okay, anyone else now wants to try academically? Now look at both the images. You will see there is air in the muscles in the subcutaneous area. This is subcutaneous emphysema, and there was the ginkgo leaf sign, and the subcutaneous emphysema was the answer. Okay. Unfortunately, we are not giving it to anyone, but they got -5.
कोई बात.
Okay, कोई बात नहीं. करेंगे कोशिश तो number भी कटेंगे, कोई बात.
You have to play all out.
Next, again, there is only images.
Only an image.
No, nothing else. Ready? Give the diagnosis. Okay.
I thought you all will jump on this one.
Yes, Team D.
Oh.
You're saying no cardia, -5. Okay, so the correct answer that we have is anthrax, bacillus anthracis, and gram-positive bacteria in rods. Okay, ready? Ready for the next image?
Just an image.
Coming your way. Madam is getting ready. Everybody is getting ready to observe them like eagles. Yes. Identify.
B.
Team B. What is the final answer you're saying? A and B are 2 images there. Yeah, I don't know. We have right one.
Menkes kinky hair.
Menkes kinky hair.
All right.
Okay,
yes,
okay.
we'll give it to you.
Okay, perfect. Menkes kinky hair disease, and trichohexis invaginator. Perfect. I think these are the correct answers. Full marks. Okay. Next is
But कोई बात नहीं, trichorexis
अलग होता है. Okay. So
Sure,
okay,
no
zero
plus
marks.
and no minus.
We'll give you
क्योंकि
0 marks.
एक सही
I think
हुआ.
I also heard it some different, but I think we got confused. Okay, are you ready? Okay. Next is the question where the font size will
Oh God,
you might have to come
but
closer, but
they are all going to bounce
if
on this.
you
I know
want
that.
to, I know, but you will still. So the question is easy. So little bit get your eyes
Yeah,
ready.
if you want to come forward, you can. सारे आ जाओ ताकि एक दूसरे को धक्का ना लगे. आ जाओ.
पर गिराना मत किसी को.
हाँ.
एक एक आ जाओ सब में से. नहीं चलो सारे आ जाओ.
नहीं नहीं कोई बात नहीं, आ जाओ आ जाओ.
अब ये तो कांड हो गया यहाँ पे. अब कैसे पता चलेगा? रेडी? देख रहे हो भाई कौन है? Name the criteria and in which condition it is used. Okay, any answers? Okay, the time is up now. Time is up. Time is up. Any answers?
Anybody? No.
Not like this.
Have you heard of these fancy criteria?
The answer was fancy criteria of acute fatty liver of pregnancy.
Yes.
Okay, please be seated now. Final two questions of this round and a delicious lunch is waiting for you after this. Okay, final two. We are not cutting your marks here, not giving you any marks, nothing. Okay, easy question. You just need to identify the scientist.
Easy. That's okay. No worries.
Okay, so no answers. So he is the guy called as Waldo Nelson behind the Nelson's textbook of pediatrics. Okay, next image. You have to give the diagnosis and the condition to be screened. Okay, two answers are there. Diagnosis and what is the condition to be screened in these patients? Team E, yes.
No, they just rose their hand. Do you want?
So they were just combing their hair. Any answers? Time is up. So we are looking at scleromyxedema and MGUS was the screening to be done. Okay, final question of this rapid fire round is this. You have to identify the drug shown. Capture this in the video. Capture the enthusiasm. See, Team C, yes. They are saying
Yes.
luspatercept, correct.
Very
Team C gets
nice.
plus 10 marks. Well done, well done. Team C gets it right.
Super
And the
duper.
correct drug that we are looking for was luspatercept, erythroid maturation agent.
Okay.
Perfect.
So now
Off-label use in low-risk MDS.
We'll just see if we are correct at the same level. So as per me, Team A hasn't scored anything but a -5.
In this
Okay?
round. In this round.
In
she
this
said.
round, only in this round I'm talking about. Team B has got 2 correct answers. Okay, Team B has 2 correct answers. Team C has maximum 4 correct answers. Team D, you have, okay, Team C has 4 correct and 1 -5 also. अच्छा 0 करा था, okay, चलो ठीक है. So 4 correct. Team D has 3 correct answers, but you have a -5 as well. 3 correct and 1 -5. Team E, only 1 -5. Okay.
Ma'am, we also had 1 -5.
B also had? Okay, that's very.
Good sportsman spirit. Give them a big hand.
I am so sorry for the miss, but yes, that's very nice of you. And Team E had 1 minus 5. Team F has 1 correct and 1 minus 5. Okay. So please put minus 5 also for Team B. 2 correct and 1 minus 5. Yes.
So in the next round, we will look at questions on recent advances. I think before we go for the recent advances, it's a good idea to take a lunch break of half an hour. Have a good lunch, and then we come back and do the final 2 rounds.
Yes, so we will move to another round. We have 2 more rounds left, and after that we will be announcing the winning team, and definitely you can see we have some prizes as well to give you. So let's back to the business. Over to you, Dr. Sumer. You can introduce about the round and everything.
हाँ जी. इससे पहले कुछ informal करवाना है इनसे?
Informal. Yes, yes. We can do one thing.
मुझे लगता है डांस करा दो, हाथ उठाओ ऐसे.
All right.
नहीं, I'm just kidding. मतलब थोड़ा energy boost up करते हैं before we go to the final round.
Okay. Let's do one thing. Quickly, we'll do that. That thing which we did on our 25 years completion event. You simply, there's no music, but we will create the music with our hand. Okay, we are going to create the music with our hands. So when I say 1, clap 1 time. When I say 2, clap twice. Yes, 1, clap. 2, and no, at 2 only you have to clap once only. Yeah, and when I say 3, you have to clap up in the air and you have to say hey. Okay, what you'll say? Hey, yeah. 1, 2, 3. Wonderful. So we'll do this 5 times और आपकी energy देखो कैसे वापस आती है. All right. So everyone, 3, 2, 1, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Wonderful. Now please give some cheers to yourself. You have played wonderfully till now. Now let's see what we have got ahead.
Okay. So in the next round, the theme will be recent advances. And what we'll do is we'll have a set of 12 questions. And what we have decided is first 6 questions will go as usual from one team to another, just how they go in a round. Final 6 questions will go to all the teams together so that you can write your answer, so that we introduce an element of fairness in the final 6 questions in this round. Okay. So total of 12 questions. First 6 questions will go from team A to F, 1 by 1. No passing will be there. Only plus 10 marks will be there. No negative marking, no passing. Okay. Team A, are you ready? Team A, are you ready for your direct question? Okay. Is your mic okay? Yes, okay. Everybody's cheering you up. You seem to be the crowd favorite. With respect to cystic fibrosis, what is the device shown below? How does it help? It's a very common quizzy question. Timer. They have time. Yes.
You want to give an answer?
What is the name of the device? Directly going to the second part only, no? Without the first part. Okay. So time is up. Anybody else wants to just give it a shot? Yes, correct. It is a capilla, which is a lung flute, helps to clear out mucus and pulmonary secretions, oscillatory pep and flutter valve, prevent atelectasis and air trapping. Okay, but because you did not give the name, so the use is not.
There were 2 parts of the question, so we'll give you plus 5 for telling what it does, but no marks for what the device is. Okay, so plus 5 for team A.
Okay.
Team B, are you ready?
I will show you something. You need to identify and another part. There are 2 parts again. Okay?
Again, yes. Identify and mention the use.
Identify the image and tell the use. Identify the image and the use. Some fine finding, they have wanting to come close and check it.
Yeah, because it's annoying.
Time is about to get up. Time is up. Time is up. Yes, final answer. Yes, beta. Any answer? Team B.
Drone like delivery.
Okay. Anybody else wants to try? No marks to you. Anybody else wants to try?
Anyone?
This is a new kind of therapeutics which is called as the digital therapeutics.
So, we have always heard about mobile phones doing bad things to the little kids. This is the one which is going to do
This is the endeavor reaction therapy for digital therapeutics for attention deficit
to
hyperkinetic
improve
disorder.
the attention span. So, it's good.
I would love to play this game. Okay. Team
It's for
C.
8 to 12 years old.
I am 16 years old.
Okay. Team C,
Team
are you
C,
ready?
are you ready? Yes. On your marks, identify the device and its use.
It is the Watchman occluder device, which is used to, prevent a clot from being formed in the left atrial appendage.
Perfect.
Very
Full marks.
wonderful.
Full marks.
Please
Well
put your
done.
hands together,
Well
please.
done. This is the Watchman device for left atrial appendage closure device. Very good. You got it all right. Full marks. Okay. Team D. Direct question for you. Team
Are you
D.
ready, bachas? Okay.
Okay. You have to look at the image and identify and the use both. Okay. Identify and the use.
Device for OSA.
Okay. Anything else you want to tell about it? Any name, anything comes to your mind? I think you're on the right direction.
Yeah.
Anything want to add? Okay, I think we can give you the marks. It is the XIII OSA device.
It is the
for the
OSA
obstructive
device.
sleep
For obstructive
apnea to
sleep
mild
apnea.
OSA and snoring.
Very well done. Okay.
This is the
Please
first
clap
device
for
used
Team
while
B.
awake. This is used while you are awake to improve the tongue muscle function, prevent tongues from collapsing backward and obstructing the airway during the sleep. Okay. Now
Team E.
it is going to be a slightly longest question, so take your time.
Ready?
Team E. You have to name the recently FDA approved drug to treat patients 1 year old and older with CD55 deficient protein losing enteropathy, also called as the CHAPLD. You have to name the drug.
Name the drug.
Team E. Searching for the answer. Okay, it's not written there. Okay, Team E. Any answer?
Team E, do you want to come with an answer? Time
is
is also up.
Time up. Okay.
Anyone else who
Anyone
wants
else wants to give an answer?
No negative marking, no plus marks also, but you can try.
No.
It is a
It is
Zimab, but
Pozilimab or CD55 deficiency with hyperactivation of complement angiopathic thrombosis and severe protein losing enteropathy.
so INICET exams are very fond of asking these newer drugs, so it's a good idea to sort of put it somewhere
Okay.
at the back of your mind. Yes.
Okay, final direct question for Team F.
Team F, are you ready, bachas?
Identify and tell us where it is used. Identify and tell us where
Something to use we will tell, ma'am. Use we will tell.
Okay, tell.
To wipe. Secretions wiping hydrosis. Something to do with that secretions, wiping of secretions, everything, removing secretions in case.
Anybody else who
it is.
wants to give it a
That's
try?
not the perfect answer.
Afflovest.
Afflovest is correct. It is Afflovest. Yes. What is it? It is a high frequency chest wall oscillator used in cystic fibrosis, bronchiectasis, MS, neuromuscular disorders. So we are not giving you any marks here. So you don't get any marks in this round so far. So the next 6 questions, we will change the pattern now. In the next 6 questions, the question goes to all the teams. and you can write the answer.
So everybody will write, we'll come and see, and everyone who answers this correctly will get the plus marks. But to have a downside, since it's an open, if your answer is incorrect, should we keep -5? No? Okay, no minus. Chalo.
I think let's not have minus, because if there is minus, then we should do it with the buzzer.
Oh, all right.
What do you say?
No minus. Chalo.
Make or break?
We are very, very, you know, we are on your side. We are weird quiz masters. Okay.
Okay.
Chalo. Ready, everyone?
Okay, ready? Start writing your answers now. Identify and mention the use. Identify and mention the use. Once you write it down, just press your buzzer.
Yeah, I'll come over. Okay. Which team pressed the buzzer? Okay, C. This is one. Okay. Okay. And where did you write the use? Okay. Okay. Yes, please. Okay. Are we ready? Are we trying? Can you write the full form for me? Okay. Yes, bachas. Okay. Are you? Okay.
Okay, how many of teams have got it right?
Yeah, can you give just your pen for it? All right, so I think we have correct answers from team B, team C, team D, and I think also from no. So, and E, F, F, right? So B, C, D, and F.
Please clap for team B, C,
Well done,
and
give
F.
them a round of
C,
applause.
D, and F.
So the correct answer is transcranial magnetic stimulation used for major depression, depression with anxiety, migraine, OCD.
Okay, good job done, people.
Okay, ready?
Well
Ready
done.
for the next question. Ready for the next question, okay? I will show you something. You need to identify and also tell the condition, okay? Ready? Identify the investigation and in which condition it is used. It is a potential INICET question in the next year.
Let me know when I can come to you. Yeah, I'll come to you as soon as you press the buzzer.
Okay, quickly. We have to remain in time. Some people have flights also to go back. Time is up, Beta. Quickly
All
now.
right,
Okay, start
anybody?
writing down.
Time's up. You can ring the bell if you have finished writing. Team A.
Okay. Hanji bacha. Okay. Yes, team B, are you ready? Okay.
Team F is ready.
Team C? Okay. All right, I've written the name. Okay. Hanji, are you ready, bacha? Okay. Team F, are we ready? Okay. All right. So, I'm going to give some marks to team A. Well done. Team B, team D, and team F. Why? Because all of you have identified the condition correctly. Achalasia cardia. Right?
And the investigation is?
But the name of the device is, so Dr. Smay, maybe
Functional
you can help.
Human Imaging Probe, FLIP.
So it is called
It's
as
used for
FLIP.
achalasia, FLIP.
Okay. So to teams A, B, D, and F, 5 marks.
Please clap
Okay.
for team.
Yes,
For
well
the
done.
teams. Share.
So
Okay.
well done everyone, well done.
Okay, so in the next image, I will show you a device and you have to tell the device and the use. Ready? Identify the device and give its usage. So whenever we show you some recent advances, these are all
Yes, they are
potential
very
questions for your central exams.
And I hope you know that the number of image-based questions in NEET PG and in INICET has been increasing. Yes? So IBQs become really
Okay.
important. Okay,
So
I think
let's see the
team
answers. A.
Are you? I'm just coming to you to check your answers. Okay. Yes, bachas. Okay. Okay, okay. Yes. Okay. Okay. Hanji bachas. All right.
Team A wants to say something.
I'll be back with you in a moment. Okay. Okay. Yes, you wanted to show me something else. Okay.
Okay, so how many teams?
Let's see. All have got it.
Okay. So I think all of you have given almost a similar answer, but that's not correct. So all of you thought this is to prevent the clot to reach the pulmonary vessel. But
That's not the IVC filter. This is in the bronchus that we are showing you. So this is Zephyr endobronchial valve used for treating breathing difficulties in severe emphysema. Shows improvement in 15% pulmonary function.
okay.
Okay, so next question is going to be a slightly tough one. Let's see if you can answer. Name the new FDA approved
इनको नया नया आता है.
subcutaneous C5 complement cleavage inhibitor used to treat acetylcholine R receptor antibody positive generalized myasthenia gravis. You need to name the drug.
Okay, I am there.
Team C and Team F.
Team C has, okay, Team F has also flipped. Okay. Which other team? C has already
Any answer?
pushed. That's okay. I'm not going to
Any
test you for your
answer?
spelling. Okay.
Any answer?
Okay.
It's almost right. I think they're on the right direction.
Yeah.
Okay.
Okay. Team A, bachas, are we ready? Okay. Team F.
So
You already showed me something? Yes, I think. Yes. So, okay. Only team B has given the correct answer. Everyone else has written the similar drug. Okay. So, baki jisne bhi answer diya, you wrote the same drug, but only team B's answer is correct. So, well done.
correct
team
answer
B.
is zilucoplan, subcutaneously given macrocyclic peptide for C5 terminal complement
B.
inhibitor. Okay. Next is a slightly longish question.
Well done,
so
well done.
start writing. Identify the sign and your diagnosis. 36-year-old woman, bilateral ascending lower limb paresthesia followed by paraparesis, preceded by viral illness. Symptom nadir was 11 days from onset. Partial response to steroids, lymphocytic pleocytosis, normal glucose protein, negative OCP.
Let me know when you're ready.
I think it's a tough one.
But these people are tougher.
Time is also running.
Anyone ready with the buzzers? Which team? B? Yes, bachas. Okay. Any other team? Okay. Team D is also ready. Okay. Any other teams? This is the answer? Okay. Anyone
Team
else?
F also.
Yes, bachas. Okay. All right. Yes. Tell me. Yes, bachas. Okay. I don't think we have the correct answer by any of the teams. Okay.
I told you it is a tough one. So the correct answer is the central enhancement sign or the trident sign seen in neuropsychosis. Okay. For the last question of this round.
Sign. Okay.
Yes. So for the last question in this quiz, in this round, we can actually go on the buzzer methodology, I think. Just to make it more energetic. Just to make it more energetic, yes.
No, they don't want it. Let it be.
Okay. So it is a tough question anyhow. Let's see. Identify A, B and C and their mechanism of action. All three only, then only marks will be given, otherwise no marks.
No.
Okay, any answers? Start writing it down. Start writing it down. The time is already about to up. You have to mention all three and mechanism of action. Tough one. It's a tough one. That is why we wanted to go on the buzzer here, but you want to do it, so continue.
Anyone who wants to give it a try?
Okay. Anyone wants to try it out, or should I tell the answer? All three drugs are required. You need to name the mechanism.
Yes, Prakash.
Anyone else?
Anyone else? At least something. That's right. Anyone ready?
So because nobody is giving the answer, I'll tell you the final answer. So the final answer that we have are, the first A is Tegafur, which is a prodrug of 5-FU. B is otiracil, orotate phosphoribosynthase ribosyl transferase inhibitor. C is Gemiracyl dihydropyrimidine dehydrogenase inhibitor. Okay, this was the answer. Okay, so we come to the final round now. Very quickly we'll do the final round. It is going to be a rapid fire round.
In which also the last chance
to make it big and win and beat others now. And in this round, if we have the scores ready, or do we have them ready? So I think we can have scores before we discuss.
Yeah,
let's see the scores once.
All right.
We'll just let you know.
So what we'll do is we will open the questions for you in this round, and you will have 60 seconds to keep answering. We will keep telling you right or wrong, right or wrong. 60 seconds.
But it is going to be for respective teams.
Yes, okay. For the team, 60 seconds, keep answering, and we will keep telling right and wrong. You cannot come back to a question if you say wrong, if you answer incorrectly.
It's better to go with the next question, because the more you get correct, the better it gets.
Yes.
Okay?
All right, so we are giving the calculated scores of both 4th and 5th round, and we are disclosing the final scores as of now. All right, let's begin with Team A, E-Zone Kolkata. So the score is 55. Please put your hands together.
Very well done.
65. It's 55.
65.
Okay.
65.
All right. Now let's go to Team B, West Zone Ahmedabad. So the score is 120. Please put your hands together for Team B.
Well done everyone.
All right. Now we have Team C, Central Zone Mumbai, and the score is 140.
Hey, well done.
Amazing. Now next we have Team D, North Zone 1, Delhi, and the score is 120 again.
Well done.
140.
130.
I've got 120.
Okay, 130.
Okay.
We'll make the corrections there.
All right, let's go to Team E, North Zone 2, UP, and the score is 65. Still doing great. And we have team F, South Zone, Hyderabad and Bangalore. The score is 70.
Okay. Well done, everyone.
So team, okay, all right. So now we have got 130. तो अभी competition नहीं है किसी के बीच में.
Can I have the sheet?
But team C is leading.
Correct.
And after rapid fire round, we'll know that who is the winning team. But meanwhile, clap for all the teams. You have participated really well as of now.
Before we do the final round, एक बार और clapping करा दें इनकी.
Yes, absolutely. I think
एक बार और वो
you
1
guys
2
are doing
clap.
really, really well. So buck
1
up,
2 clap.
everyone. A big hand of applause for all of you. You know.
Yes, we'll do that one wala 1 2 3 hey wala again. Okay. So you got the spirit again. That cheerful spirit we want. With the smiling faces you have to do this time. All right. So everyone, 1 2 3. 1 2 3.
Hey.
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 Amazing. Now clap loudly.
Perfect, perfect. Now we come to the final round of this grand finale of DAMS Grey Matter, where we will decide who is going to take home the final top prize. In this round, we will have 10 questions for each team. Each question carries 10 marks. There are no negative marking. If you skip, you can answer it, but if you answer it incorrect, you cannot come back to it. We will keep saying right or wrong after your response. I will show you all the 10 questions together. 60 seconds will be your time. Timekeepers?
Timekeepers?
60 seconds. 60
1
seconds. है ना? 1 minute के अंदर as many as you can answer. Keep answering. We will keep telling right, wrong. 10 marks there. No negative marks. Once the time is up, then no more questions can be taken. Ready? Team A, are you ready? Are you set? Okay.
Yes. So your set of questions are
Now.
on the screen now. What is Curarino triad? All right. 4 is okay.
Why
Can you?
Why no? Correct.
Okay.
Correct. 4. Correct.
Incorrect.
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 Keep answering, beta.
Time is ticking. Time's up.
Time is up.
Which one are you giving the answer for, bacha?
Cutis Lexa, what are you saying? Tell the drug. Amiodarone. Incorrect.
Incorrect.
Okay.
All right.
So let us see the answers and then we'll discuss.
You
okay?
have 2 correct answers.
I think
bacha.
you have to correct, but we'll just revise with you.
Clap
So,
for team A.
well done. So the questions were: what is Curarino triad, which is sacral agenesis abnormality, anorectal malformation, presacral mass, a teratoma. Cutis lexa is caused by penicillamine. Replacement of aortic valve with autograft from patient's native pulmonary valve is called as Ross procedure. Webino is wall-eyed bilateral internuclear ophthalmoplegia seen in multiple sclerosis. New drug for WHIM syndrome is mavorixafor, which is what you got
You
right.
got correct.
In which metabolic condition liver kidney transplant is indicated is primary hyperoxaluria. It is a previous question. Artery of Bernacsoni and Casinari is a branch of meningohypophyseal trunk. Tails hernia is hernia in front of femoral vessels. Banana bodies are seen in alkaptonuria. Most common nerve injured in laparoscopic hernia repair is lateral cutaneous nerve of the thigh.
Cutaneous nerve of thigh.
So I think you got 2 correct.
Yes,
2.
so plus 20 for team A.
Plus 20.
Well,
Well
done,
done.
team A. Good
Okay.
job.
Now I'll invite team B to come forward so that they can directly see the screen. And you can keep answering. We'll keep saying right, wrong. Ready? Ready? Go.
Protest side nasopharyngeal carcinoma.
Correct.
Palatal sulci. Tartrate resistant acid phosphatase 4.
Incorrect.
Gupta buddies actinomycosis.
Which one? 9. Yes, correct.
Correct.
11th, 10th is anastomosis, Ru and Y anastomosis, hernia influenza, behind the Ru and Y.
Correct.
Okay, correct.
10th is iliopsoas.
Correct.
Correct.
Adam-Kivitz artery 7.
3
7th is incorrect.
6. Swan Duam.
SUA procedure 3rd.
Correct.
Correct.
6 is
Sixth is
cataplot.
correct. Time is up. Time is up.
Okay.
Time is up. Well done.
Well done, Team B.
Well
You've
done.
got
They deserve a round of applause.
6 answers correct. So
Okay.
well done.
So we'll just go through the answers for the other teams. The question was Trotter's triad is conductive hearing loss, immobility of the soft palate, trigeminal neuralgia seen in nasopharyngeal carcinoma.
Which you
got
answered
it
correct.
Day blindness caused by trimethadione. Endorectal pull through for congenital megacolon suaves, which
You
you
got
got
it correct.
right. Expand trap was twin reverse arterial perfusion.
perfusion. But
Okay, I think we can give it to you. Eprosidate drug is used in which deposition disease? Amyloidosis. You did not get it. Diagrammatic representation to represent correlation between two continuous variables.
Scatterplot, which you answered
You got
correct.
it correct. Arteria anastomostica auricularis magna Kugel artery.
this is
Anastomosis with the right
between-
coronary artery and left circumflex. Peterson hernia is hernia behind under the row limb
Got it correct.
after row and Y gastric bypass. You got it right. Gupta body actinomycosis. You got it right.
correct.
Muscle attached to lesser trochanter iliopsoas. You got it
Got
right.
it right. So
Well
7
done.
correct.
7 correct.
And plus 70 for Team B.
Very
Wonderful.
good.
Please
Awesome.
clap
Awesome.
for Team B, everyone.
Awesome. Awesome. Well done. Beta.
Well done. Team C, bachas, are you ready?
Yes. So once you say ready, I'll just show you the slide. Team C. Are you ready? Okay.
Hakim's triad is normal
Correct.
pressure hydrocephalus.
Correct. Correct.
Okay.
Stemmer's hernia is in front of the Ru and Y anastomosis.
Forest plot for 6 meta-analysis. Funnel plot also.
Forest
6
plot
is
is correct.
correct.
Forest plot is correct.
Rohard is hypothalamic.
Second, hyperkalemia.
Correct.
And
Arterial circle of Vuesens is between the right and the left conus arteries. The anastomosis.
Yes, correct.
Correct.
10 is zidovudine.
Zidovudine, correct.
Yes, correct.
Time is
Time
up.
is
So
up.
let us quickly count. I think
You've
you
got
six.
6 correct.
6.
Team
6
C.
or 7. Let's see. Let's see if you. Let's just review with you.
Yeah, we'll review with you.
Hakim's
don't worry.
triad is seen in normal pressure hydrocephalus, dementia,
Which is correct.
urinary
You
incontinence,
answered.
magnetic gate. Sodium, zirconium, cyclosalicylate, sucroferric oxyhydride, salbutamol,
you answered
hyperkalemia.
correct.
You got correct 2. Between the damaged cornea replaced with part of conjunctiva is Gunderson flap. You did not get it. Rohard is rapid onset opacity, hypothalamic dysfunction, hypoventilation, autonomic dysfunction. Sapropritine dihydrochloride is phenylketonuria. You did not get it right. Diagrammatic representation meta-analysis forest plot. You got it correct. Annulus of Vuesens is
They got it
anastomosis right and left conal artery around infundibulum. Correct. Stammer's hernia. You did
Was
not answer
incorrect.
fully.
You
did not
said
answer.
it's the hernia in front of femoral vessels.
In front of the Ru and Y.
So it was not fully answered. I think the answer that we have is hernia occurring through the window in the transverse mesocolon after retrocolic gastrojejunostomy. So I think the enough details were not there in your answer. Gamma antibodies are seen in congestive sphenomegaly. Correct. You got it right. Drug of choice in perinatal transmission of HIVs. Zidovudine. Correct.
So 6 correct.
6 correct. Well done.
Well done. So Team C gets plus 60 marks.
Okay, Team D, now please come forward so that you can do the final gambit to see who wins. Are you ready?
Are you ready, Team D?
Is your mic switched on? Can you check it? Perfect. Ready to go. These are the questions.
Correct.
Correct. Correct.
Yes, correct.
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 Correct. Correct.
Correct. Which question? No.
Incorrect.
Incorrect.
Time is up.
Time is up. 7 correct.
7 correct
Well
for
done.
Team D.
Well done. Well
We'll
done.
review them.
So we'll review the answers very quickly. Saint's triad is colonic diverticulosis, hiatal hernia, cholelithiasis.
Which you got correct.
Correct. Well done. Drug extracted from croton licheri acts on enoanectamine 1 channel used in HIV associated diarrhea is clofazimine.
You got it
You
correct.
got it right. Procedure in which a flap of bladder wall is fashioned into a tube to replace the lower ureter is Bory. You got,
You got
it correct.
correct.
Nestroph is naked eye single tube red cell osmotic flagellity test.
You got
Thalassemia
it
trait.
correct.
Right. Nitisinone is used in hereditary tyrosinemia type 1. You got it correct. Diagrammatic representation used in survival analysis Kaplan-Meier. You got it correct. Third coronary artery arising from right anterior aortic sinus direct branch. Narath hernia is behind femoral artery in congenital dislocation of hip.
You got it correct.
Right. Ruston body odontogenic cyst. You missed out. Sakaguchi test is used in guanido group of arginine. So I think you got 7 of them right. Well done. Well done.
Plus 70 for Team D.
Very good. So as we come to the concluding round, I must congratulate all the teams for being super brilliant teams.
Yes, definitely. We all must applaud for Team A, B, C, and D. Come on.
Yes. You have answered more than our expectations so far. You know,
Team E,
हमें
please.
लगा नहीं था इतना आप बताएंगे आपने से ज़्यादा बताया. Okay, so Team E, come forward. Are you ready? Perfect. Sena, correct.
Please be a little loud.
Please be loud, beta.
Cerebral autosomal dominant arteriopathy with stroke-like leukoencephalopathy.
Correct.
Schiller-Dubel,
Which one?
Which question are you answering?
endodermal sinus tumor, Schiller-Dubel body.
Yes, correct.
The artery of Adam-Cavius is the large anterior spinal artery. The
Which one are you answering?
7.
Okay, correct.
Correct.
Question number 5, Sella-Del-Par.
Incorrect.
Pi square. T test the counterpart.
Incorrect.
Third is switch procedure. The
Time is up. Incorrect.
government switch procedure.
Incorrect. Time is up.
So you've got 4 correct, bachas. So we will discuss.
We'll just review the answers, so that there is no discrepancy. So Charcot's triad of multiple sclerosis is scanning speech, intention tremor, nystagmus. Melanosis coli is caused by bismuth subsalicylate senna. You got it right. Procedure in which claw hand is corrected by extension carpi radialis brevis is called as Paul Band's procedure. Cadacil is cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy.
You got it correct.
New FDA drug for primary biliary cholangitis which acts by PPR alpha PPR delta is elonofibrinor. Non-parametric counter test of T-test is Mann-Whitney U-test. Artery of Adamski's is large anterior segmental medullary artery. You got it right. Serafini hernia occurs behind femoral vessels without congenital dislocation. Schiller-Duval bodies are seen in yolk sac tumor.
Also called as endodermal sinus.
You got it right.
Correct.
World Multiple Sclerosis Day is May 30th. You missed it. So total
plus,
4.
Plus 40
Plus
for
40.
Team E.
Team E.
Please clap for Team E. Everyone.
Well done, beta. Well done. And the final team now comes forward for the
And
last
the results
question.
later.
Last set of the questions of the DAMS Grey Matter
Are you ready,
national
Bachchan?
quiz conducted every year to find the best brains in the country. Are you ready? Is your mic working? Be loud. And
Yes, sir.
whenever-
We are ready.
Perfect. But whenever you are answering, just say question, say one answer, so that it's very easy for us to find the answer. Okay, ready? Give the question number also. Okay, ready? Go.
Seventh, Nicola Brandry science.
Correct.
Correct.
Comparison of new test with gold standard. Pulmonary artery hypertension, type response strong, autism spectrum, antileptic. Bollinger's. Vadal, no idea. Bollinger's, okay. Richters. Bollinger's. Foul Fox, Bollinger's.
Correct.
Ninth question.
Correct.
Is the kind. Metal diverticulum is a kind.
Which question?
Eighth one. Hernia through Meckel's diverticulum.
Incorrect. We don't have that answer here, but the time is up. So
Time is
you've
up.
got two correct.
correct.
We will just review the answers
We'll
with you.
review the answer and see if we can add something or not. Okay, so the final set of answers. Waddell's triad is femoral shaft fracture, intrathoracic, intra-abdominal injury, contralateral head injury. Autism spectrum disease caused by which anti-epileptic drug is sodium valproate. Strong procedure was superior mesenteric artery syndrome. Syscom is subtraction, ictal spect co-registered to MRI. New drug for pulmonary arterial hypertension acting by activin type 2A fusion protein is sotatercept. Test for comparison of new test with gold standard is Bland-Altman test. Sign in which AV fistula pressing leads to decrease in heart rate, increase in BP, Brody disappears is Nicolandi-Brandman sign. You got it right. Richter's hernia was part of intestine, protrudes through the small defect in the abdominal wall. Bollinger bodies is foul pox. You got it right. World Dengue Day is June 15. So I think you got two correct.
Two correct. So plus 20 for you, Team F.
Well done.
Well done.
Wonderful. Please clap. And with this, I think that quiz session is over.
Yes.
And of course, the moment we are waiting for results time. So I think we need to calculate the final marks first. And meanwhile, what we can do that we can interact with them.
Yes.
Yes, perfect.
We would
Apart
definitely,
from- yeah.
yes, we would definitely want to know how their experience with the Grey
Yeah.
Matter quiz has been, and anything that they want to also tell about themselves, what they like doing apart from studying. Yes.
Yeah.
So any extracurricular things that you are interested in or you're good
Okay,
at.
name the last movie that you saw. Buzz around.
Great.
Perfect.
All right. So let's hand over the mic to her.
All right. You have the mic? Okay. I have the mic. Yes, let's not do with the this
Team
thing.
wise.
Team B, you talk about yourself, anyone.
Let
How
us
was
know
your
something.
experience? And after this, what are you going to do? Anything.
Like managing studies during internship is, balancing very hard. But Grey Matter gave us a reason, to study.
Okay.
So, yeah.
Great.
Meanwhile, we also got.
So it was a fun experience for you.
So come on, we want to know from you, what else do you do apart from extracurricular activities? Let us know what de-stresses you, what helps you maintain the balance that you are always looking for, right?
I do write.
Right. Do you write poems?
Mix, like poems.
Wow.
Anything that you have written, can you share
Can you read
one or two lines?
Maybe
That
two.
would be great, yes.
Maybe just a few lines. Just a few lines.
हो सकता है जिसके लिए लिखा हो वो भी सुन रही हो.
Like it's a micro tale. Every day she used to take bus at work at 9 a.m. but hardly used to found a space to sit. One day he saved a seat for her, and that was the beginning of something beautiful.
Wonderful.
Oh.
Great.
Very beautiful.
And
Not
can
only
we have...
these are tips for future aspirants.
Yeah.
ये डैम्स की क्लास में भी जब आ रहे होते हो तो सीट अगर रोकोगे किसी एक के लिए तो इट माइट बी यूजफुल, बट अगर बहुत सारों के लिए रोकोगे कुछ नहीं मिलेगा.
Okay, maybe we can have a few words from Shloka and Janvi as well. Go ahead, girls.
So, participating in Grey Matter has always been a pleasure for us, and this is our second Grey Matter here, and it was like an offline one was a really memorable experience.
Yes,
Thank
for
you
us
so
as
much.
well, for us as well. And Shloka, what do you like doing apart from studying? You have to tell us. Nothing, she does nothing. I'm sure she's going to tell us something. Binging on what? Web series. Okay. Which is the latest one that you saw?
House MD.
Usme bhi House MD. Okay, great. And what about Janvi?
I used to generally spend time with my friends and reading books.
Wow, okay.
Other
So
than
what genre of books do you like? Is it fiction? Is it romance? What is it?
Mostly
Science fiction.
non-fiction storybooks.
Okay.
Real life storybooks.
I thought you would say encyclopedia. Okay, great.
All right, great. It's so good to know Team B. Now let's talk to Team E. Yes. Please, Team E. We can start with anyone.
So Divyanshu goes first. Okay.
Yes, ma'am. My name is Divyanshu Yatra, and this is my first experience like competing with the students at this level of grade. I've only heard about the term prodigy, and this is for the first time I've seen.
Okay, great.
I am, all you guys are equally great, and you've been fabulous throughout the quiz, all of you. So I must congratulate all of
I've
you.
seen these people competing like in the previous DAMS Grey Matter quizzes. I've seen the videos. I've seen like if I am sure like you might be sure like this team might have won last year. And I also know Abhinav is friend of my friend Himanshu Jindal. So also I've seen I know some of the people like, but I have never introduced myself to them and vice versa as well.
Great.
कोई बात नहीं, अब बता
So
दे
today
कि
you get
अब
an
बता दे मैं आ
opportunity.
गया हूँ अगली बार के लिए.
And what do you like doing, Divyanshu?
So I used to do gym and I used to swim and play basketball and football, but because of the hectic internship, like I have to sideline all that for some time now. I'm focusing on
Great. But I'm sure you'll be back into swimming and your athletic side very soon, yes? Great. So let's hear it out from the girls. Ananya and Shruti.
Hello ma'am, myself Shruti. So I used to watch this quiz before 2019, before joining MBBS, as a sort of motivation.
Wow.
And I never thought that
Even before MBBS?
One day I'll be coming here.
I would thought you would say intrauterine life. Okay, great.
And I brought this book to get it signed by sir. This was also like before 2019. I used to like see you people and get some sort of motivation.
That's very sweet of you.
Really
The
great
pleasure is all ours. It's been a privilege for us.
Great, definitely. Also, we must applaud for Dr. Sumer and Dr. Deepti for
Why?
being such great quiz masters.
I think they were putting their brain and they were doing all the hard work. We were just here bucking them up, right? So what do you like doing, bacha?
Man, in the free time, I usually cook for my roommate. And we usually study together. So in the free
You
time,
cook?
Whenever. Yes,
What is your favorite dish? And when do I get
Most
to
of the time
eat?
I cook Maggie for my roommate. Like
Yes, she mentioned that she cook in the free time only.
I also cook Maggie.
Great.
And we study together and like in whatever there's a free time, either we used to go to like cafes and all, I just fight with it.
Nice. Great. So the team that, fights together also wins
So
together.
what do you
Good.
want to become later on? Just because you've already decided in 2019 itself that you will reach so far, so you must have thought beyond also.
So always I wanted always to become an tiny person, but then during this internship, and when I did
कई बच्चों के ऑब्स गायनी के सपने इंटर्नशिप में टूट जाते हैं.
Crash.
Oh God, the chillam chilli and everything. Oh God.
I can understand.
Yay, that's us.
But then there's something in me. I just know I will become an organic.
Great. So a great Ojishin in the being, and I'm very proud. Yes.
अब ये सारी चीजें देखने के बाद भी तू करना चाहती है. Give her a round of applause. Well done.
Ananya.
Hello sir, hello ma'am. Ma'am, my name is Ananya and I'm really happy to be here and just witness this event live. And I also swim and I read non-fiction books and fiction also and movies and
Generally, I just do everything. That's great.
One thing that I wanted to ask is that nowadays, many of you are saying that you like reading books. Do you think this will continue in the next generation? Like, और छोटे बच्चे अब पढ़ेंगे किताब को भी ऐसा लग रहा है कि
No,
सब
but the
वीडियो
Kindle
गेम
has also become like an accessory. It's there, but it's just there.
All right. So I know that you're waiting for the results, but quickly we will ask everyone to introduce
So
themselves.
let's hear it out
Yes.
from Team A.
Yeah. Quickly, you have to introduce yourself. Yes, one by one.
Semantika, maybe we can start from you today. Yes, from Team A. Let us know about yourself.
Hello, I am Shemontika from Medical College and Hospital, Kolkata. I had a very good experience in today's quiz, learned a lot of new things, and I am happy that I came up till here and I could participate.
That's a great thing.
That's all I have to say.
Great. And I got to know that you're a good singer.
Ma'am, it is my hobby.
Yeah.
It's my hobby.
Are you feeling a little better to sing a line for us?
Just one line.
Just one line.
Yeah, it will be like really beautiful.
She's unwell, but yes, just one line.
रामावध में काशी में शिव कान्हा वृंदावन में दया करो प्रभु देखो इनको दया करो प्रभु देखो इनको हर घर के आंगन में राधा मोहन शरणम सत्यम शिवम सुंदरम सत्यम शिवम सुंदरम
Atti Sundaram.
Very
nice.
Awesome,
Wonderful.
awesome.
Thank you, Shemantika.
That's a beautiful voice and a beautiful selection of a song as well. Thank you so much. Thank you. Yes, boys, let's hear it out from you.
Hello, ma'am. Hello, sir. I am Ahitagni Mukherjee. I study in XIII Medical College, Kolkata. And if you ask about my hobby, it is mediquizing itself. Like my best friend Ankit is sitting beside me, and it was due to him I was introduced into this field of mediquizing, and ever since he has introduced me, I have become addicted to it so much so that any mediquiz happens in Kolkata or even colleges around it, so my friends turn, you have come here also. Do you come in every mediquiz and show up and like that? And apart from that, ever since internship has started, like home internship duty,
Right. But that's great. So keep your quizzing minds on, and I think you're doing a fabulous job. So wonderful, and thank you so much for being here. So Ankit, वो तो हमें पता लग गया that you've introduced him to the world of quizzing. What else you do?
Yeah,
What else have you introduced him to?
Yeah, actually, I like to do mediquizing with him, and we give mediquizes here and there. But apart from that, I also like to play cricket.
Okay.
I'm a big cricket fan, and apart
Favorite cricketer?
Virat Kohli.
Other than Dada?
Virat Kohli.
Virat Kohli, okay. My favorite is Saurav Ganguly actually.
But do you have the attitude of Virat Kohli? You look to be a very sweet boy.
Yeah.
Chalo, great.
Virat Kohli is also very nice guy.
Oh, he's very amazing. Okay.
Yeah. Thank you, Ankit.
Yeah, just want to conclude that I enjoyed a lot in this Grey Matter
Thank
quiz.
you.
It was my first time, and competing with these great minds, it was a pleasure for me.
Absolutely.
And I would love to do it again and again.
We would love to have you here, and I'm sure they've enjoyed your, company as well. Team C, can we hear it from you? So who's going to start? Maybe Junaid can start telling us about himself.
Hello, this is Junaid Sheikh, intern at XIII Medical College. It is a very good experience to be here, and it's my first time in Delhi, so it was another reason to come here.
Wow.
मुंबई से दिल्ली कैसा लगा मतलब?
It was a terrible experience.
Did we be a good host?
Yes.
Yes. Okay. And there's this recent web series going on where they have this. Maybe you guys don't know it, like Bollywood vibes and something. So that's always about Delhi, Mumbai, right?
Yes.
So वो fight चलता रहता है उसमें, and you reminded me of that. Yes. But we're not fighting here. We're just playing the quiz. Yes.
Yes.
Great.
In my free time, I play chess and I follow chess avidly.
Wow.
And other than that, I like to spend time with friends and family.
Okay, just for personal reasons, do you play online? So
Yes,
is there a
sir.
group that you play on? But which is the best group to play on?
She's asking
I
for
play
a
on
kit.
Lee chess.
D chess.
Lee chess.
Lee
Li
chess.
chess.
Okay.
Yes.
Okay. Great, thanks. I would give those inputs to my son. He loves to play chess as well. Maybe I'll ask him to find you and play with you once.
Sure.
Yeah?
Hello everyone, I am Devan Banerjee, an intern at XIII Medical College. It was my second time attending the Grey Matter quiz,
Wow.
first time offline. And
Great.
it was a great experience, and one of the most surreal experiences was to shake hands with Sumer sir. I've always seen him in the screen of my phone, and seeing him in person was really a very surreal.
It's my honor to shake hand with a future great doctor who will surpass
Yes, it's been
everyone
our
else.
pleasure to meet all of you.
My
in
blessings
fact.
are with you, beta. Best wishes.
And the DAMS team has been very hospitable and helpful throughout this journey, and
Thank
I have really loved the quiz experience. Thank you.
Great. And tell us something about yourself, Devan. You can't go like that.
Well, I collect stamps and currencies.
I used to do that when I was a
And,
little girl, though.
And I play cricket, not that I'm very good at it, so that's
That's okay. That's okay.
Favorite cricketer?
Sachin Tendulkar.
Obviously.
Is it because he's from Mumbai?
No.
And Kohli is from Delhi? Okay.
Nothing like that. I am not from Mumbai originally.
Okay.
Where are you from?
Great.
Kolkata.
Kolkata. He's studying in Mumbai. Yeah.
Good afternoon, sir. Good afternoon, ma'am. My name is MBBS. I'm an intern at XIII Medical College.
Right.
Last year we had given with our senior Devesh.
Yes.
And this was the second time we are first time offline.
Great.
And as Deban said, really grateful to Team DAMS for the opportunity. And the entire team has been very cordial and hospitable, facilitating our journey from Mumbai to Delhi today.
I'm glad the team helped you.
Thank you, ma'am.
Great. Amay, and what do you like doing?
Ma'am, mainly I read a lot of non-fiction, and I follow football. So
Wow. Okay. Great. So that's wonderful.
All right.
So we have, apart from cricket fans, we do have a football fan as well, right? Great.
Yeah,
Okay.
please clap for Team C. Once again, a very warm welcome. And now Team D.
Girls first.
They are passing on the mics.
Yeah.
Good afternoon,
Good
everyone.
afternoon, Bacha.
I'm Vidhi Gupta from Maulana Azad Medical College. This is my second time as well. This offline was more good of experience.
Yes.
I'm happy to be here. Thank
So are
you
we.
for the opportunity.
Thank you, Vidhi. Do let us know something about yourself. What else do you do apart from studying?
I like playing badminton, walking, going, having talks with my parents and friends.
Great, that's
Very good.
great.
Hello everyone, hello ma'am and sir. I'm Abhinav Agrawal, intern at AIMS New Delhi. So this was my first time and I'm very glad that this was a offline event
Yeah.
so that I get to meet other teams like the people from XIII whom we have already competed in online events and people from DJMC also who fought in the last quiz.
Yes.
So as you would have already guessed, I like doing quizzing.
Yeah.
And Harsh has been my partner for quizzing since the very start.
Great.
And like this is most likely the last or second last quiz that we are giving together of our UG life.
Yes.
And so
It's always going to be memorable, right?
yeah, so this is a emotional quiz for us also. And I like to play badminton. I like to do gymming. I play keyboard, and I watch movies. Thank you.
Wow.
Awesome.
Okay. Great.
Good to know you.
Hello everyone, good
Hi.
evening ma'am and sir. I am Harsh Jain from AIMS New Delhi. So I enrolled in the gray matter quiz like on the very last moment. So I take out the time from the OPD and then solve the quiz, and fortunately I got selected.
Yes,
in the
we are
finals.
glad you gave it timely.
And I am very happy to be here and I really enjoyed the quiz. I like to have fun with my friends in the free time, and I also like to play cricket.
Cricket? Great. And
Awesome.
who is your favorite cricketer?
Virat Kohli.
Virat
Virat
Kohli.
Kohli.
Great.
Thank you, Team C. Please clap for them. Now we have Team F.
Team F, yes. So let's hear it out. Who's going to start? Shambhavi is going to start? Yay.
Good evening. This is my second time in the Grey Matter quiz. It was offline last year and that was my first quiz. And after that I didn't do any quizzing for 1 year. Then again I came back here and I noticed that I had learned so much in 1 year, and it was like a really good stimulus to be alongside the greatest UG doctors in India, and I used to like get inspired by them and study over the last year so that I'd be in a better place this year. And I've seen myself improve. I was able to answer more questions this year than last year.
It's always about the process, right? I know winning is important, but I think the process is even more important. Yes. Because
Learning
you
is
learn
more
so
important.
much. Yes.
And I'm so grateful that we got a chance to come offline. This is my first time in Delhi too. And it's the first time I'm meeting Deepthi ma'am in person. Sumayya sir had come to Bangalore last year. I'll be meeting him again when he comes to Bangalore next week.
Definitely.
And I loved meeting all the fellow competitors. I loved meeting my team in person. I met Bhuvan before, but I met Sairam the first time. We had a great time together. And the team was amazing. Kanika ma'am coordinated with us all along, and it was very nice of them to arrange everything for us right from scratch. And about me, I love running. I'm a runner. I run marathons and I do yoga.
Wow.
Other than, studying.
That's wonderful. Keep it up.
Give her a big hand.
I am Saira. I am from Allareddy Medical College, Hyderabad. I am from Vijayawada local. So, I just first want to thank all the DAMS faculty and entire management team for excellent hospitality. And I never forget this because this was my first flight journey from the DAMS. I never forget this because, and coming to me, I want to tell like I was completely different thing. You might think my wishes are like, but I was more focused on listening to music. Moreover that I watch all the local movies, I watch more Telugu, but more of national politics, all state, whenever the elections and whatever the issues
Politics.
correct, more of that.
Oh, wow. That's
So
that's a new, I mean, a different hobby.
Different thing. So
Great,
it's
great.
different.
That's wonderful.
Thank you, ma'am, for like arranging everything.
It's
And
an absolute pleasure.
since
And
I will follow constantly the dance, everything, the quizzes, everything, I feel like if you go that motivation, what you say every time, next INICET you will be having, I felt like it's coming to here and participating. It's like very happy. time. Thank
absolutely, it's been a very, very memorable journey for us as well.
Hello, ma'am. I'm Bhuvan from Bangalore, Ramaya Medical College, and since first year, I've seen the Grey Matter quiz, and it had always been a dream to come and be a part of it. And I'm so glad that I was able to do that. And I'm such a huge fan of Sumer sir and Deepthi ma'am, and I'm glad that I got to meet both of you in person here.
And I think we are
Very,
very,
very great.
happy to meet you all in person, and we will give a quick bow down to all of your intelligence.
Thank you so much for traveling, for taking out your precious time. I do understand your interns, your busy duties. You had to travel from far off, and I'm also thankful to your parents to have allowed you to travel all by yourself, right? So please give my regards and gratitude to them as well. Thank you so much for everyone here. And what do you like doing?
I like playing badminton and doing physical activity like running.
Great. So मुझे लग रहा है यहाँ बैडमिंटन वालों को मिला के उसका भी एक क्विज
मैं भी ये सोच रहा था बैडमिंटन वालों की दोस्ती करा देते.
Great.
And I would like to say that this is something I won't forget in my life. It has been so memorable, and it's been so good competing with such smart people. And thank you, ma'am, for giving us this opportunity.
And if I remember correctly, you used to play a lot of badminton in your college days. Yes?
I know. I don't ask me to play
win,
now.
okay.
Okay. So before we go for the results, let me invite all of our team forward here in the center of the podium. And we will all give them a big hand for organizing everything effortlessly. Scorers and the YouTube team, camera team, everyone, please. This quiz will go on YouTube as well. So you'll see it on YouTube very soon. So be your best self when you're receiving your rewards. Be smiling. You will get a lot of friend requests. It will go on Instagram. So on that side, maybe on.
So thank you so
Wonderful.
much, team,
Please
for
put your hands
organizing.
together for the team.
Give them a big round of applause. Well done.
So thank you for making it a good event, something that students would remember. So thank you.
I think we have done a lot of grey matters offline, and a lot of them we have done online. The online thing started with the COVID.
Yeah.
So earlier we were always doing it offline. Then after COVID, I think this is the first year where we have come back to the offline, and meeting you in person has a next level vibe altogether.
Absolutely.
It's much better to do it as when we do offline quiz. So thank you for coming all the way and participating. So let us ask now the team to give us the final scores.
Yes. All right. Yes, I know everyone is waiting for the results. See, no matter what the result is, but you all have participated really well. We must applaud. Now, अपने लिए please आप तालियां बजाइए and just watch me happily. ऐसे stress में मत देखिए. Okay, so I will start from Team F. Final scores we are giving. So Team F, South Zone, Hyderabad and Bangalore has got 90 marks. Please put your hands together. Now next we have Team E, North Zone 2 UP has got the 105 marks. Please put your hands together for them. And Team D, North Zone 1 Delhi has got 200 marks. Come on, put your hands together loud for them. Wonderful. And everyone, Team C, Central Zone Mumbai has got 200 marks.
Oh
as
my
well.
God.
We have got two teams with the same marks.
Great.
First, let me tell all the marks to all the teams, and then we'll see how we are going to decide the first winner. We have got Team B, West Zone Ahmedabad with 190 marks. Please put your hands together. And we have Team A, East Zone Kolkata, 85 marks. Please put your hands together.
Well done, team.
Amazing. Many congratulations. Best wishes. All right, so Team C and Team D has got the same marks, 200. How we are going to decide the winner, I don't know.
Okay, so what we'll do is we'll have a tiebreaker module that we have thought of, that team C and D, can you stand up? The teams which are at the
Same marks.
same marks, yes. So what we'll do is, we will do a penalty shootout where one person from each team will come. And the first topic will be drug of choice. Second will be investigation of choice. Third will be any syndrome.
So three
Drug of
questions.
choice, investigation of choice, syndrome. You have to ask each other. Okay, it is penalty shootout. And so you have to beat the other guy by asking the tougher question. Let's see. Okay.
No, but
so,
then if they ask and nobody is able to answer anything.
three kicks will be there. No?
Yeah,
So
three. There are three questions.
So one of each will come for a duel, and then like
So whom are you guys recommending from team B?
team B. Yes. Send your best men forward.
Yeah.
See, one guy, one girl, you will ask one question each. One question, if you say drug of choice, then your second partner will have to do the investigation and third will have to do the syndrome.
So each one of you gets one slot.
One slot. If it is not resolved, we will think of
We'll have
further
another
methods.
penalty round.
We'll do a arm wrestling then.
आजाओ. So पहले कौन आ रहा है? The first question would be DOC.
They are already preparing. They are already preparing. So make better answer
So
questions.
who's coming for drug of choice from team B, and who is coming for drug of choice from team C and team D? Yeah, the first question is
Otherwise,
about drug of choice.
somebody is asking for somebody asks something very high-fi. It's not making sense.
दोनों
So we are
drug of
looking
choice
some symmetrical.
पूछेंगे, फिर दोनों
Something
investigation
symmetrical
of
we want.
choice, फिर दोनों X syndrome.
Something to do with the drug of any disease.
Close match for everyone.
I think this is one quiz where till the end even we could not find that who's going to win because it was always closely fought.
All right. Let's have someone from team C and
अच्छा
someone
यार
from team
इतनी
B.
तैयारी
आजाओ.
तो एग्जाम के लिए भी नहीं करता कोई यार.
All of you will get an opportunity. Come. Who's coming?
आजाओ,
Okay,
drug of
drug of
choice.
choice.
Come in the
आजा.
center. The warrior number one. Give them some music. Dun, dun, dun.
Great.
And facing him opposite.
So we have Abhinav from team D. Yes.
Dun,
And
dun, dun. Okay, are you ready? Let me give
we
you the
have
mic.
Debayan from
Both the
team C.
warriors are ready.
Are you ready? You ask him one and he asks you the other.
So my question is, what is the drug of choice for pyruvate kinase deficiency?
Drug of choice for?
Pyruvate kinase deficiency.
You have to tell the answer yourself also.
I don't know, pass.
It's
Okay, what is the answer?
it's metavipad. What? Metavipad. It's a new drug.
Okay, it's a new drug. Why don't you ask him another question?
Okay, now it's your turn.
What is the drug of choice for tenosynovial giant cell tumor? It is a new drug which has been approved used for tenosynovial giant cell tumors.
Yeah, it's okay. Anything about the drug?
I don't know.
Okay, what is the answer? You have to give the answer.
Pexidartinib.
Pexilatin.
Pexidartinib.
Okay. One man down for each. Who's coming next from team C? The next is investigation of choice. Do we have Junaid from? Okay. No, you decide.
Hello. Okay, can you now come over to the second question of the tiebreaker?
Come on, boys. You're well prepared. And here we have Junaid from team C.
So we're the first warrior. Dun, dun, dun.
All right, team D. Who is going to have a face-off with Junaid?
So far the scores are 0-0. Can you make it happen in the tiebreaker?
Of course, yes.
It's just like penalty shootout. Ronaldo is coming from the other side.
Junaid is already here. Who is coming from?
Investigation. It's something to do with investigation choice. Could be pathological investigation, radiological, biochemical, anything. Any investigation is okay. Okay. I think they are reading some books by the time.
Use of mobile phones is prohibited.
Acha.
No, you cannot.
You will give him a passover. Okay, next 5 seconds. If you don't send the warrior, we will have to say pass.
All right.
Okay.
Welcome, welcome.
Okay.
Investigation of choice for ABPA.
For?
Investigation of choice for ABPA.
HRCT.
Yay! Vinayak gives the correct
HRCT.
answer.
Yes. Now is the time to take the lead.
Gold standard test for insulinoma. For diagnosis of insulinoma. No.
Okay. Junaid, what's
It's
your name?
intraoperative ultrasonograph.
All right.
We'll take it. Okay. So 1 up.
Team C is one
Team C
up.
is now 1 up. Can you make it even in the final face-off? So now only one warrior is left
So
on
we will
either
have
side. in both the
Amey
teams.
from Team C for the syndrome.
Syndrome. Any syndrome you have to ask.
And we would have Vidhi from Team D.
Okay. Can you come over? Hello. Okay. Time to come. We will, on the count of 5, we want both the participants to be in the ring. 1, 2.
We didn't want to be the bad people, huh?
We have to get them. They are preparing and endlessly preparing. 3, 4.
And Amey is here already.
So he's already there. Be
Ajao
there.
Vidhi.
Yes. I think they have told her a syndrome that she herself has not heard of.
Okay, Vidhi goes first. Ask.
Syndrome which mimics, which is juvenile sarcoidosis, which presents like juvenile sarcoidosis photosensitivity in a kid.
Okay, what is the answer?
Blau syndrome, not 2 deficiency, not
Okay.
2 defect.
Okay. So now is your turn.
7-year-old child brought to the emergency. Mother complains that earlier he was extremely jittery, but later suddenly there were episodes of fainting, and currently the child is unconscious on bringing. This is the 4th or 5th time that it has happened in the last 3 years. On head-to-toe examination, the child is not conscious. On probing the history, there is a developmental delay of almost 2 years. On gross examination, the child is fine. On systemic examination, you can observe that the nails of the child are dry. There is flaking of the nails which is seen. And at some places, such as the buttocks and the heel, there are cracks in the skin. What is your diagnosis and what is the defect in the skin? Sorry?
Previous episode.
Yeah.
If you answer, it will be a tie again. ₹50,000 are at stake, just to remind you.
Candle syndrome.
The answer is Rapson-Mendel-Hall. It is young diabetes with ectodermal dysplasia and nail dysplasia. It is a receptor binding defect regarding the insulin action, which is explaining the symptoms that jitteriness, again a sign of hypoglycemia, and then fainting episode, recurrence, slight developmental delay of about 2 years, and then the nail fold drying and ectodermal dysplasia.
Well done, well done.
Wonderful.
So finally, actually, you
So we
got
have
to
a
know.
tiebreak.
At least now you got to know how the footballers feel when they have to come for the penalty shootout. It is very easy to tell them that, you know,
All right. Check.
तो समटाइम्स इट इज वेरी इजी टू से कि ये तो आगे जाके सिर्फ एक किक ही तो मार के गोल करना था, बट जब खुद करना पड़ता तो मुश्किल होता है. सो फाइनली व्हिच टीम हैज वन? Can we have the final winners of the DAMS Grey Matter? Who's the winning team?
Right. So we all know that Team C is the winner, right? Team C is the winner.
Give them a round of applause.
Wonderful. Team C Central Zone is the winner. I'll be calling everyone. So first, before I invite the winners, I would like to invite Dr. Sumer and Dr. Deepthi to please come forward. As we are recording it, so we will be giving you the prize here only, so we can record it.
Okay. Is that also? I think this is better. Okay. Second
All
runner
right.
up.
Yes. So I'm going to invite second runner-up, and we all know that which team it is. This is Team B West Zone Ahmedabad. Please welcome Dr. Janvi Dev from BGMC Ahmedabad, Dr. Shloka Thakkar and Dr. Nishit Thakkar, BGMC Ahmedabad. Everyone, please put your hands together loud for all of them. Also with this, they are getting the prize money of rupees 10,000. This is for the team. Come on everyone, clap. Maybe it will be on chance next time. Many congratulations, Team B.
All together.
Very well played. Great. Congratulations.
Well done.
Now I would like to invite our first runner-up. Yes, certificates also. Thank you. Now we'll be inviting our first runner-up team, and please welcome Team D, North Zone, Delhi. We have Dr. Abhinav Agrawal, AIMS, Delhi. We have Dr. Vidhi Gupta, Maulana Azad Medical College, Delhi, and Dr. Harsh Jain, AIMS, Delhi. Please put your hands together for the team, everyone. And along with this, they are getting the prize money of 25,000 rupees for the team. And also all the winning teams are getting the free course. Wonderful. Many congratulations.
Just see the name. Best of luck. God bless you. God bless you. आगे से नहीं, अभी तो नहीं आया मैसेज तो नहीं आया, अभी तो कोई मैसेज नहीं आया.
And everyone, we have our winning team, Team C, Central Zone. We have Dr. Junaid Sheikh, XIII GS Medical College and KEM Hospital, Mumbai. We have Dr. Ami Abhijit and Debayan Banerjee from XIII GS Medical College and KEM Hospital, Mumbai. These are the winners of the very famous DAMS Grey Matter Quiz Season 13. And also with this are getting the prize money of 50,000, everyone. Put your hands together. Amazing, amazing. Many congratulations.
Well done. Congratulations.
And please put your hands together for Team A, Team E, Team F also, everyone. They people.
Well done.
And the Team A, Team E and Team F will be getting the certificates. So don't forget to collect them. Alright, so you will be called for the photograph for the certificates. So first I would like to invite Team A, E-Zone. Please come.
God bless.
Alright, Team A, we have Dr. Shamantika Mandal from Medical College, Kolkata. We have Dr. Ankit Das, Archikar Medical Hospital, Kolkata. We have Ahitagni Mukherjee from Archikar Medical Hospital, Kolkata. Many congratulations to you as well for participating really well. Thank you. Thank you, Team A. We request Team C and Team D to please settle down. Photographs are still going on. Team B, C and D, please settle down. You are coming in the photographs. Now I would like to invite Team E, North 2 Zone. We have Dr. Divyanshu Shukla from GSVM Medical College, Kanpur. We have Dr. Shruti Singh from GSVM Medical College, Kanpur. And Dr. Ananya S from RML, Lucknow. Many congratulations, Team E. You have played wonderfully. Certificate, yeah. Thank you,
Well
thank
done.
you.
God bless. God bless.
Now next I would like to invite Team F, South Zone. We have Dr. Innamuri Sairam from Malla Reddy Institute of Medical Sciences, Hyderabad. We have Dr. Bhuvan Rajesh from Ramya Medical College, Bangalore. And we have Dr. Shambhavi Kulkarni from Campigora Institute of Medical Sciences, Bangalore. Many congratulations. Please put your hands together for Team F as well, everyone.
This is